Peter Wittich. I am the chair of the research network of Deafblind International, and I am your host for the Deafblind International webinar, Living with Deafblindness in a New Reality. I want to start by thanking our financial supporters for this week. First of all, Deafblind International itself, and then we have additional support by the Quebec Vision Research Network and by TANE, Schweizerische Stiftung für Taubblinde in Switzerland, both of whom have provided us with additional funding to provide international sign language interpretation for the entire week. I also would like to thank the members of our organizing committee, specifically Frank Kat at St. Lucas, who is the president of Deafblind International in the Netherlands, Mirko Bauer at TANE in Switzerland, Jude Nicholas at Stadped and Haukeland University in Bergen in Norway, Saskia Dahmen at the University of Groningen in the Netherlands, Michelle Borton at Sensity here in Canada, and me being part of the committee as well in Montreal. I want to also give a general thank you to all the presenters who have submitted their work for this week, who are giving their time and their energy, and who are battling with us on the technology. We have over 3,700 registrations for our sessions. This translates roughly into over 400 people who are attending our webinar this week. So it's one of the largest events that Deafblind International has ever organized. And we're very excited that it's working as well as it is. All right. So our sessions are being recorded and we are hoping to have them on the website of Deafblind International relatively soon. This will give you the opportunity to catch something again in case you miss it today, or if you need a little bit more time to follow the presentations. You've already noticed that we have sign language interpreting. For those of you who prefer to have this image larger, in the viewing options of Zoom at the top right corner, you have the possibility to share the screen and you can make the image of the interpreter a little bit larger. Today's interpreters are Leah and Rob, who will be alternating, and they are also the reason why I am going to follow the time very strictly, because we will give them a 15-minute break in between our sessions. In terms of our rules of engagement for today, you will have noted that everybody's microphones are muted and everybody's cameras are closed. This is so we can focus on the content of the presenters and we will be able to concentrate on their message. If you would like to know more about Zoom instructions, if this is a new software for you, there are some resources available on the website of Deafblind International as well. You will also see that for almost all our presentations, we have two presenters, a primary and a secondary presenter. The reason we have done this is that we encourage people to use the chat function and to ask questions or write comments at any time. This way, while the first presenter is giving the actual presentation, the second presenter can follow the content of the chat and can help bring questions into the presentation and help type answers if that is necessary. For those of you who are active on social media, we encourage you to write about the webinar on Facebook, but we also ask you, if you're on Twitter, to use the hashtag DbI webinar or to tag DbI_connect if you want to tweet about the event. All right, so that is it for my little housekeeping notes this early in the morning. And now I'm going to hand things over to Steve Rippley and Justine Lawrence, who I believe are joining us from Australia. Evening for them. Steve, Justine, are you there? You may have to unmute your microphones. And if you can activate your cameras.
Hi.
We have a little bit of echo.
We're trying to work out.
So if both your presentations are in the same room, one of you might have to turn off their microphone. And there you are. Excellent.
Good evening from Australia.
Good evening, and all over to you. We can't wait to hear what you have to tell us today.
Wonderful. Thank you for that. Thank you very much. Our presentation this evening, or today anyway, is called A Time of Change. And it's a time of change for deaf-blind people in a particular region of New South Wales called the Hunter area. Okay. Now, the first thing I would like to do before I begin is I would like to acknowledge that the land on which Justine and I stand is Aboriginal land. This land was stolen from the traditional owners. It was never given to them by the English Crown. Atrocities were committed against the First Nations. And Justine and I would like to acknowledge the Darug Nation as the true and rightful owners and custodians of this land. It was, is, and always will be Aboriginal land. So, who are we? Justine is a deafblind consultant who has had many years of working with deaf and deafblind people. Along with a colleague who was deafblind himself, Justine was instrumental in establishing the Hunter Deafblind Group, and now she coordinates the Deafblind project team in the Hunter area. I, Steve, am deafblind, and I am a peer mentor and deafblind communication trainer. I wear hearing aids and glasses. My hearing aids and glasses are tools. They are not me. These tools, they give me some idea of sound and vision, but they do not clarify my perception of the world around me. I use Australian Sign Language as my main form of communication. I read both Braille and large print. Justine and I have a unique combination of lived experience and practiced knowledge to support deafblind people to have more control in their lives and to become more connected with their communities. Using lived experience and peer support, we help bridge the gap between the person with deafblindness and the services and systems around them. This is to make sure they can access what they need to be an equal and active citizen in our community. The Hunter Deafblind Group, I will introduce them. The Hunter Deafblind Group began after identification of deafblind people living in the Hunter area of New South Wales, Australia. The group was founded by a young deafblind man after he moved to the Hunter area. He approached a community worker requesting support to locate other deafblind people. From that initial contact, he learned to coordinate peer support workshops and social outings with support of tactile sign language interpreters, deaf support workers, and volunteers skilled in working with deafblind people from the deaf community. A little of the history of disability in the Hunter area. The main focus for disability support was an institution called Stockton Center. This was established in 1910 by the New South Wales Government of Australia. This institution, over the years, looked after hundreds of people with various severe disabilities. Often people were admitted because of lack of knowledge regarding their disabilities. Others were admitted, then forgotten about. In 2018, the government announced that Stockton Center was to be closed, and all residents moved to small community-based houses. Over 350 people were institutionalized at the Stockton Center when the Deafblind project team began working with residents who had been identified as being deafblind. All deafblind residents had been admitted as children. No formal communication was provided. All were misunderstood as having profound intellectual disabilities. Lack of interaction and communication resulted in extreme neglect and deprivation for anything up to 55 years. This institution is currently devolving. It is closing. Residents are being transitioned to small group homes. Full closure of the Stockton Institute is expected to happen by the end of 2020. Stockton Center is a well-known institute in the Hunter area. The Hunter Deafblind group was passionate about connecting with deafblind peers from that center. The question was, how would we make this happen? We believed that relationships were the key to ongoing partnerships. Discussion with management of Stockton Center commenced in early 2019. A project was established which was run by deafblind peers to connect with deafblind people living at Stockton Center. Quite an historical moment for deafblind people who had been institutionalized for some 50 years, finally making contact with peers from the community. The main difficulty lay in engaging with the gatekeepers providing care to the deafblind residents at Stockton Center. Many of the management and staff had worked at the center for over 20 years and had a misguided belief that deafblindness automatically equates with intellectual disability and required psychiatric medication. Identifying deafblind residents at Stockton was initially impeded by a lack of understanding by the Stockton staff about the definition of deafblindness. Stockton estimated number of a few deafblind people was in fact many. The deafblind peer workers began offering support to day option staff working with deafblind residents, providing deafblind awareness training to Stockton staff, and interacting with the deafblind residents, which provided development of communication skills via tactile and socio-haptic means, as well as increasing daily living skills. The Deafblind project team also participated in resident transition meetings, offering transition strategies which encourage deafblind residents to be involved in their transition of moving into supported independent living. We believe very strongly that communication is a human right. Through interaction with deafblind residents and casual discussion with various staff, we identified areas of neglect and deprivation of all Stockton deafblind residents. All residents had been robbed of their communication rights for well over 50 years. What was reported by staff and psychologists as, quote, escalated behavior was in fact clear expressions of hunger, thirst, pain, trauma, abuse, and the list was endless. There was no formal diagnosis of dual sensory loss of vision and hearing. There was no formal or basic interactive communication. All deafblind residents were diagnosed with psychosis by psychiatrists who were not familiar with communication deprivation, nor did they have any knowledge of deafblindness. Until the deafblind peer team became involved, there was no interaction with the deafblind residents. All residents had been placed into separate accommodation with people who were likewise neglected, and there was no interaction. Three deafblind residents were actually identified by a deafblind worker as having attended deaf schools or deafblind day programs before being placed into Stockton Center. Residents previously had sign language skills, but had lost those skills over the years. We believe it's true that to affect a deaf-blind person's life, we need to work one person at a time. We believe strongly that building relationships and circles of support are necessary to help that person. Steps were taken to develop intentional relationships with each individual deafblind resident to identify uncovered potentials, wants, needs, likes, dislikes, and preferences. This was achieved largely by employing deaf support workers and deafblind peer support workers. The Deafblind project team contacted management and staff of Stockton in order to identify the key people in each deafblind person's life. Basically anyone who had been in contact with each deafblind resident. Attempts were made by the Deafblind project team to reunite the deafblind resident with their families wherever possible. If the families were not interested in involvement, then permission was received for the Deafblind project team to provide ongoing support. Deafblind peer workers and deaf support workers introduced or reintroduced tactile communication methods prior to the deafblind resident transition into the community houses. Change was achieved by actively building connections, both paid and unpaid, with and around each deafblind person. Deafblind residents, along with their support workers, were introduced to service provided in the community, along with coffee shops, swimming pools, grocery stores, etc. The Deafblind project team became strong advocates for change during the deafblind person transition to ensure that the group home did not become a replica of the institution they had left behind. It is unfortunate that many group homes are simply smaller versions of institutions. Paradigms need to change. The importance of deaf support workers cannot be pushed aside. Deaf support workers are instrumental in supporting change at Stockton and in the community. Deaf support workers with signing skills and who were familiar with deafblind people in the deaf community were instrumental in introducing basic tactile communication, a human right which had been ignored by the Stockton staff. Deaf support workers were also able to introduce deafblind residents of Stockton to other deaf and deafblind people in the deaf community. One deafblind resident now regularly visits the local deaf senior group each Wednesday. Deaf support workers also introduced communication strategies between the deafblind resident and the public community members when accessing the local community for leisure or shopping. A side note is that at the end of each contact with the deaf support worker, it was commented by Stockton staff that deafblind residents, quote, suffered escalated behaviours for hours after the deafblind support worker left. Obviously, the deaf support workers were the cause of the deafblind residents' traumas. Another group which was established through this journey was the Hunter Deafblind Connect. The Deafblind project team initially provided 2 separate deafblind awareness sessions in the Hunter area. An invitation was extended to service providers, allied health professionals, families, support workers, and anyone interested in working with people who are deafblind. After the deafblind awareness session, a participation survey was handed out, and from those surveys, a number of training sessions and meetings were established. A monthly 2-hour meeting is now held, where participants can share their relevant areas of expertise in supporting people who are deafblind, such as orientation and mobility, tactile reference objects, art therapy, mental health and deafblindness, and so forth. These meetings also encourage discussions and meetings with deafblind people who are able to share their lived experience. Not only does this meeting encourage greater awareness of deafblindness, it also provides connections with wonderful people in the allied health workers area, occupational therapists, orientation mobility specialists, art therapists, and speech therapists. We want to be a part of a community-led approach to developing support with deafblind people. So we knew that if we would truly tailor this to the needs of the community, we had first to establish what their needs were. Raising awareness about deafblindness is very important. This awareness that we have provided has included training for networks of support, mainly in the deaf support workers environment, with family members and group home staff. We believe that communication is a human right. For deafblind people, this is often primarily through touch. Group home policy may advise against the touching of residents except to assist them. We often have to raise issues with the policy of the group homes, which actually may further isolate the deafblind residents. Each group home is provided with deafblind awareness training. The training is individualized, person-centered, focused on the deafblind resident in the group home, providing new skills to both the deafblind resident and the group home staff. All deafblind residents from Stockton were never allowed to explore the world around them. In the group home, training is provided to the staff regarding the dignity of risk. The dignity of risk means we allow a person within reason and with appropriate support to make mistakes in order to experience consequences. The inclusion of deaf support workers demonstrated the importance of deaf lived experience, as well as provided meaningful interaction and activities for deafblind residents. Families were not always involved in the lives of deafblind residents from Stockton, nor in the group homes. Family involvement was encouraged by us, or permission from the families was obtained to provide daily activities to their deafblind family members. The world of COVID-19. When it became clear that COVID-19 was widespread, the ensuing lockdown meant further isolation for many deafblind residents, both at Stockton Center and in the Hunter area. Efforts were immediately made to link deafblind residents with deafblind support workers and sign language interpreters. A schedule of Zoom visits was made to encourage connection with the Hunter deafblind group. Interpreters and support workers used iPads if the deafblind person did not have technology at their home. The monthly Hunter Deafblind Connect continued training and discussion via Zoom. Webinars were scheduled to present topics such as tactile reference objects, art therapy, and mental health of deafblind people. Group home training continued. 2 days of deafblind awareness training have been provided to staff at group homes. Deafblind awareness focusing on deafblind residents who will transition from Stockton Center or who have already transitioned from Stockton Center. Further training and consultation is provided with people and staff in the group homes via Zoom or limited contact. Follow-up support to staff of group homes is ongoing in order to address the concerns and questions staff may have while providing support to deafblind residents. Overall, COVID-19 has caused restricted access to directly working with many deafblind clients. However, the support of those people has not stopped. Our aim to provide person-centered support for people who are deafblind and living in the Hunter area continues in a new way. For deafblind people who have formal communication skills and are technology confident, COVID-19 has caused isolation, but has encouraged the learning of new technology skills, such as the use of Zoom. Our concern and main focus through COVID-19 has been on those deafblind people who have no formal communication skills, no technology access, and have been isolated even more by physical and social distancing. We have continued to, quote, rally in the forces to open up a wider range of support for those people especially. Thank you so much for allowing us to share our journey with you.
Thank you. This is an absolutely wonderful presentation. We have 6 minutes left of questions. If you have access to the chat, I encourage you to have a look if you would like to answer any of the questions that have been posed.
Thank you. We have plenty of comments, but no questions. But thank you for all your comments.
One of the questions here is, what sort of professional work needs to be included with the deafblind?
The professional people at this particular time are mostly to do with the occupational therapy area and some speech pathologists. We're also working with orientation and mobility trainers. The orientation and mobility trainers provide more information on orientation than mobility. Occupational therapists work with us in helping to find activities which are suitable for people who are deafblind, and also to look at the sort of tactile reference objects that help to communicate or to develop communication within the Stockton Center or group homes. And for Very much so. Australia has very few professionals in the field of deaf blindness. And at the moment, I guess I'm the one who's been pushed as the professional. I like that term. We are at this time developing a website. So for the person who's asked in relation to how to keep in contact, we will be putting up a website very soon. And I'm sure that Justine especially will be in contact with DbI to tell everyone what is happening with our project. I'm not sure if you've heard of the National Disability Insurance Scheme, which is in operation in Australia today, NDIS. So people with disabilities up to the age of 65 are receiving funding for daily living, individual funding. Places like Stockton were actually closed down by the government. In relation to the individual residents, they are receiving NDIS funding. The NDIS actually started, it was opened in the Hunter area. So I believe that the Stockton residents were some of the first people that this insurance scheme was looking at in order to transition people into group homes. Unfortunately, no communication system was established initially. When we came into Stockton Center, both deafblind residents basically sat in a chair all day doing nothing. They were almost led to the table, just given a spoon. They were fed slops as far as we are concerned, but there was no formal communication system until we came in. We are talking about 2019, 2020. 50-year-old plus have no communication methods. There are, in Australia, there are other centres which would, of course, have deafblind residents in them. Each state looked after its own centres. In New South Wales, Hunter area was the first centre who had, I guess, officially admitted to having deafblind residents there. I'm one of the oldies. I was involved with a volunteer deafblind organisation for the last 30 plus years, and we have attempted to find out the number of people at Stockton who were deafblind. Until last year, Stockton Center denied that they had any deafblind people. Once the government said you have to close the institute, that's then when they came forward and said, we have a few deafblind people, what do we do with them? So that's how our project got involved.
Steve, we are slowly running out of time, but I would like to take the opportunity to thank you and your team for presenting today. We wish you a wonderful evening in Australia, and we're going to take a 15-minute break, and we'll be back with presentations on the full hour.
Good evening from Australia.
Thank you. Bye. just as a brief comment to everybody, the reason you can't hear anything yet is because we're not saying anything. We will be starting at 7, or at the full hour, so we'll be with you in a moment. All right, ladies and gentlemen, I am going to do a little bit of our maintenance items so we can get started this morning for session 2. For those who are just joining us, as a quick reminder, we are recording our sessions and we hope to have them on the website of Deafblind International very soon. So just in case you miss anything while you are attending the session, you should have an opportunity to go back and discover whatever information you may have missed. You've probably noticed that we have international sign language interpreters that are helping us with the communication today. If you are not familiar, you have an option under the viewing at the top right corner of your screen where you can share the image, share the screen in order to make the image of the interpreter a little bit larger. You will note that we don't have live captioning for this event. We were unable to raise the funds or get the volunteers to do so, but we're working on that for next time. Now, I want to just point out a few of the rules of engagement. You will have noticed that your screens, your cameras, your microphones are turned off. That is in order for us to focus on the information that we get from the presenters. We are, however, encouraging everybody to use the chat function. If you have comments, if you have questions for the presenters, if you want to interact, we encourage you to do so. That is one of the reasons why we have asked the teams of presenters to usually be in pairs of 2. This way, while one is giving us the content of the presentation, the other can survey and see what is going on in the chat and help answer questions. All right, for those of you who are using social media, please feel free to let Facebook know everything about us. If you're on Twitter, use the hashtag DbI webinar. You can tag at DbI_connect if you want to give a shout out to Deafblind International. And now I'm going to head it over to our next set of presenters, the lovely Heather Coulson Osborne and the lovely Deirdre Leach, who I believe are joining us from Ireland. And you have control. The next 45 minutes are yours.
Hi, Walter, and hi, everyone.
Hi, Walter.
Thank you so much. Just going to share my screen and we'll get started. So we'd just like to say we're really happy to be here in this conference, which I think is great. It's giving so many people access to not having to travel to get to lots of places. We're able to reach lots of people today. So we're really happy to be here and share with you some of the things we have been doing here in Ireland. Just let me know, Heather, when you can see my screen.
Still loading.
Okay. So just very, very quickly, we're going to look at, great. We're going to look at how we've adapted our services during this pandemic. And if anyone has anything they want to question, like Walter said, please use the chat. And we will be checking it out as each other is presenting today. This is what we're going to look at. We're going to just review sort of how we've adapted our services, how we've changed, how we do outreach in residential, and how we've done some training. Okay. So just a little bit about ourselves. we find it very ironic that Heather and I aren't from Ireland, but yet we represent Ireland in DbI. So just Heather's going to introduce herself there.
Thanks, Deirdre. Hi, everyone. Yeah, just a brief introduction about myself and the work I've done and continue to do in the Anne Sullivan Centre. I've worked there since 2007, mostly in the residential houses, and I've done a bit around the staff training, and I'm currently working in the outreach, and I joined that last year. And I work with adults mostly who have congenital and acquired deafblindness, but I've started to work with children as well.
And though we work very closely together, we are currently 200 kilometers away from each other in the east and the west of the country, and we have very different backgrounds. I came from America, and I went through the deafblind program at Boston College and taught at Perkins in the deafblind program for 14 years before I moved here, and have been working in outreach since then. So my background is a bit more with children with congenital deafblindness, but right now through outreach, I'm working with all ages, adults and children. And through DbI, I'm currently the communication ambassador for Ireland and am part of the youth and the charge networks. So even though we have very different backgrounds, we're working towards the same goal, and it's reaching the people in our locality. So we're just going to look at very briefly what our center is and what it does. So the Anne Sullivan Center is 30 years old as of last year. We had a big celebration, and we have 4 houses in Dublin, where Heather is located, that serves 13 adults and 2 day service users. The majority of our service users in that locality would be have congenital rubella syndrome, but we also have a few new service users who have Usher syndrome. We have over 60 staff who work day and night and have been working throughout this pandemic. They work on person-centered plans, and they provide one-to-one support for all of the service users. And then outreach, which is only 10 years old, we provide support to people all over the country. We do assessments, and we're making recommendations based on their deafblind needs, linking with other services, and offering training. And I was lucky enough to expand the services, we expanded the services last summer, and Heather has joined me now. So we are both doing outreach at the moment. And then just to look at our numbers, we currently have only about 117 people that we are providing service for at the moment, direct service. We'd have more people on our register that maybe aren't availing of service at the moment. They might be just doing fine, but this just breaks down our numbers between early intervention, school age, adults, elderly, day and residential, and then we have a couple of advocacy groups. Okay. So Heather's just going to talk to us a little bit about the challenges we faced, and then look at the residential.
Thanks, Deirdre. So just to put COVID statistics for Ireland, just so we have Ireland in context, the population of the Republic of Ireland is just under 5 million. We've had just over 25,000 cases since February, and around half of those cases would be in County Dublin, and that's where our residential service would be. We had our first case of COVID-19 identified in the Republic on the 29th of February. So just to put in context of the challenges we face and the numbers that we are dealing with. And then the impact it's had in Ireland. For the centre, the Anne Sullivan Centre, our initial response was in early March. We rely on the updated information from the Health Service Executive with HSE. The HSE would fund our residential and day services. So we take a lot of guidance from them. And then we just are looking at how we can change how we provide our residential and day services, as well as responding to the day-to-day needs of the residents. So right from the start of March, we stopped our outreach visits and we closed our day service for our 2 clients. And we began making contact with our outreach clients and our other service providers, just to let them know what our plans were, and offering remote support as well, and starting to think how we can do that, how we can offer remote support during this time. Then I'm just going to talk about the residential services. As I've said, I currently work in outreach, but I have plenty of experience working in the residential houses. So I did cover a couple of shifts recently. So just taking a look at the support we've received and the actions taken. So the Board of Trustees and the CEO meet virtually 3 times a week. This is to discuss any updates from the HSC and any actions that need to be done. As I said, we took extreme caution from the very beginning to keep residents and staff safe. So this included counselling visits, counselling group activities and travel within the community. We put this in place before we got any government advice about this. We turned the day service room into an isolation room if needed. We upskilled and informed the staff regularly as well. So different training courses online, different training around PPE and any updates on COVID as well. We've allowed staff to work from home if possible, and that's including myself and Deirdre, of course, and any other staff that are office-based are working primarily from home. And just making sure there's plenty of PPE so that people feel safe. So we've got plenty of masks, aprons, gloves in stock as well. We were very lucky to acquire 2 empty show houses to use as needed. So this is to offer a breakaway for a resident who's finding it difficult staying in the same house, but it's also there for if staff need to isolate when they're working as well. And then the support we gave. So as much as possible, we communicated what was happening through individual communication modes. So all of our residents would use different communication. This would include signing and using visuals where possible, and also communicating through objects of reference. We also have a lot of involvement and communication from the families, and this is right from the very beginning. We contacted the families of the residents and just told them what we were going to do, what their input was and what their thoughts were as well. The main challenges are communicating at community activities, so swimming, community classes, outings, holidays, all those things that our residents really enjoy. They were cancelled, as well as family visits. So that was very, very challenging. And then we also had to communicate testing procedures, something we've never had to do before, and why staff are wearing more PPE as well. So the side effect of wearing all this PPE is the communication barrier. This is a picture of me in the residential service on one shift. So we were instructed to wear masks, and we've been wearing the masks for the past few months. But during the weeks where we were being tested, unfortunately 2 staff were tested positive for COVID. And many staff had to isolate themselves because they were in contact with those staff. Because the residents were in contact with those staff, we had to wear a mask, either a visor or goggles, apron and gloves. So while there were several companies making the homemade masks with the clear windows, which would be really helpful, we do have to wear the health authority approved masks and PPE, so the ones with no windows. So for people who use sign language, lip reading and other cues, this is very, very difficult. And so for the people who have a bit of vision, it did cause a lot of anxiety. So staff are wearing medical PPE in what is meant to be a really homely residential setting. To communicate why we were wearing it, we tried to use vocab that was familiar to the residents. So signs and words such as safe, clean, sick, just to put it in context for them and just put it in a way that they could understand why we were doing this. And then just looking at the resources we used, for people who had some functional vision, we used widget symbols. We were very lucky that there was a huge range of visual resources on COVID-19. A lot of new resources have come out, so we were able to use these pictures along with sign. And then for those who didn't use the visuals, maybe had a low level of sign language, we had to find a more concrete way of explaining what was happening. So, for example, the social story for COVID testing, we used these visuals. for people who could see, but for those who didn't have vision, we would actually use objects. So we would use, a mask. We used like a cotton swab as an example, and sort of try to act out as best as we could what they could expect when they went to the COVID testing. And then we used objects of reference, particularly for those with no vision, or some of our residents prefer to use objects of reference. So we used a box with a cancelled or finished symbol on it, and we placed the activities in the box to show that they were finished for now, that they were cancelled. So we kept this box still available to the person because they still want to talk about these activities that they're missing out on. They might want to ask questions about them. They might want to ask, when can we go swimming again? When can we go on the tram again? When can we go on holiday again? So we kept them available, but we repeated this process each week as a reminder that these activities are still cancelled, but we showed activities that were still available. So we presented those on a choice board. And as you can imagine, a lot of those activities were home-based activities. This is a case study of the house I worked in. It's called house number 20. 4 people live in this house. It's on a housing estate right next to our main building. And there's other houses that belong to us within the same estate as well, with other residents. One of the things we put in early in place was that the residents could not visit the other houses as well. And so there was no mixing between the houses, and that was also a direction from the Irish government as well, that we couldn't visit people in each other's houses. So again, that was another challenge, increase of isolation as well. The people in the house, there's 4 people in the house, and they would use a mixture of communication methods, so Irish Sign Language, tactile sign, printed words, pictures, raised pictures, Braille, so a very varied array of communication. We're very lucky that we work one-to-one, so we were able to attend to the person's needs quickly. We had to use a lot of reassurance and repetition. We responded to questions that they might have, and also give them emotional support as well, because again, they can't visit their families at the moment. And all 4 would be reliant on the staff for information. Some could access social media and the news, but again, they might have questions about what they've seen in the news and what they've seen on social media. It's not always clear, any updates, so they might need reassurance, and particularly when they might see the daily updates on new COVID cases, or the death rate for that day. That can be quite scary. So we needed a lot of reassurance for the things that they saw. Okay, so looking at the creative solutions, we use video calling wherever possible, which has been an absolute lifesaver. So for people who had vision and possibly a little bit of sign, they were able to video call their families. And again, as a centre, we communicated with the families almost every day, and they were able to contact us if they had any questions as well, or any concerns. So just trying to build up the trust and continue that trust between the organisation and the family. For the residents who didn't have enough functional vision for video calls and didn't have enough hearing for phone calls, we supported them to make tactile cards and gifts to post to the families. So that was just to maintain that family connection. And in some cases, families sent items to residents that had like a recognisable scent of home. So one family sent a jumper that had like their scent to a resident, so she was able to make that connection that it came from the family, and she was able to maintain family contact in that way. And some of the other resources we've used these before, the ASDAN booklets. So a lot of the residents would have these already, but we've definitely seen an increase in an interest in more of these booklets. They're getting through them much quicker. They're home-based education, which is something a lot of people are doing at the moment, and they are learning new skills as well and trying new things out in the house that they might not have done before. So that is definitely a benefit of the lockdown, is just trying new things, trying things that we might not have thought of before, and new activities as well. And then some of the other activities, we were very lucky during lockdown that we had good weather. and we were able to spend a lot of time outside. So this included, painting, decorating stones for the garden. The residents and staff helped paint the back wall and decorate it. And they would have done these things before lockdown, of course, but I think they've just taken much more of an ownership of their space and their garden. They've been able to really have an input in what they want and how they spend time in that space as well. So we've definitely seen a lot more DIY and home-based activities, and in turn they've learned new skills. They've learned how to paint a wall, they've learned how to do all the different designs on the wall, learning how to garden as well. So I think that's been a really good outcome of the lockdown, amongst all the anxiety and worry as well. And then I just want to end this section with a really nice picture, and this is on our Facebook page a couple of weeks ago. It's one of the residents turned 50 and the whole house celebrated with her. They worked on making decorations and party foods the whole week, so that was their focus for the whole week. And I just think it's a really beautiful picture of all four of the residents, and at times like this it's so important to come together and celebrate. I am going to pass you over to Deirdre again, and she's going to talk about the outreach service.
Thanks, Heather. So we're going to look at the outreach. Like everyone, we're so used to the face-to-face contact, and the nature of our everything we do is relying on touch. So to go from that to an online type of format, I suppose, was challenging for everyone. So we had to really rethink how we taught and how we did things. The technology, I put technology 101. For a lot of us, the technology piece was challenging, using different types of technology, contacting families that maybe didn't use online technology before, maybe preferred the phone, some preferred text, kind of figuring that out. But really looking at focusing on the positive outcomes, that we were able to still implement strategies in home settings. We were able to make more materials for parents to use. And because we weren't traveling as much, we had, more time on our hands to do these things. So I'm just going to look at now our advocacy and campaigns officer, Louise. She shared this slide with us, where she was able to, she runs 2 different groups in 2 different parts of the country. For adults who are deafblind to get together and meet socially, and to come up with ways that they'd like to advance, the cause. And so obviously they would need to meet face-to-face for tactile sign language, and just even to meet socially. So she has continued her contact with that group by email, WhatsApp. Some use text messaging, and then some would use the sign language interpreter service over the phone. So it was, I suppose, a learning experience for her as well, to really learn how to use all of those types of technologies and keep contact with everyone in her group. And then just looking at the outreach piece for Heather and I, really looking at using webinars as a new way to reach families. So we've provided, to date, we've provided about at least three kind of group webinars, and then we've also done some one-to-one consultations, and I've also done some multidisciplinary team meetings and families with the child there as well, because they're at home, and just looked at all different topics that related to just being stuck at home, wanting to continue learning at home, setting up structure at home. For a lot of parents, school is structure and home is, the more relaxed setting. And so really looking at, okay, we're going to be here for a few more months. We really need to set this up. So looking at setting up that communication. Sometimes there was questions around equipment, like hearing aids and glasses, and, how to get them to wear them more, how to get them to fit right. Different app ideas that they could do at home, and sensory activities. Some of the families we work with might have a very small garden in the back of their house. So trying to work on some sensory and physical activities would be challenging. So just trying to think of ways they could still do that in a small space was really, really helpful, I think. And as well as behavioral support, and then other resources for, books, toys, activities, and things like that. So I'm just going to do a little case study, like Heather did, about one of the consults I would have done with a little girl I work with. She's a 2-year-old girl with Chart syndrome. She's really at a great age where she's starting to make lots of developmental gains. So the parents were really eager to continue this at home. They were both working from home and you know, trying to do their best with giving her that input and really trying to challenge her. So we've had a lot of online consultations with this family, exchanging ideas, just trial and error. So I'm going to show a few examples of that. But I think the best part of the situation was because we weren't waiting for my next visit, which could be, it could be in 2 months, that we didn't wait sort of for that process to happen, that input happened immediately. So I would make an idea, a suggestion, and they would go and try it and then come right back to me, and we'd continue that sort of back and forth. So one example would be the child is very, very interested in stars. So for an example of what to do with it, I suggested that they, you know, she don't just work on stars because she's kind of stuck on stars at the moment, is to expand that to other objects and sort them by shape. So, and maybe to take things out of a bag to make more of a game out of it, because she definitely is a very clever child and she needs to be challenged. So right away, as soon as I said it, the mom went back, she drew the shapes, she taped them to the ground, she found objects around her house, and she got going. So she sent me these photographs, and she's quite happy for me to share them with you today, just to show, you know, what she was doing with that one suggestion. Then another example was the mom had seen this example online of an activity where you use baby wipes lids as little doors. And she was going to use it for visual stimulation, but I really thought that the child could handle more than that. So instead of using it for visual stimulation, I said, well, why don't we use it for naming things? Because she's very good at, if you ask her a question, she's very good at pointing to an answer, and she wasn't working on her, you know, expressive communication or her speech. So I suggested maybe work on family names. So when she opens the door, she has to say either Dada or Mama or Granny. So the mom went back and she made that straight away, and she started one. She made 2. I said she's probably going to, you know, go through this quickly and learn these. So I said think of another topic. So she's been interested when she goes on walks on trees. So the mom made another one. The picture on the right shows like trees, flowers, bushes, different things that she could learn to name. So just a simple picture with the word above it. And so when she opens the door, she's working on naming it. And if she doesn't know it, the mom is modeling the name and she's working on that. And then the third example, I suppose, being at home and, you know, working with a child who has limited communication, you know, is difficult, but not having that access to the professionals that she would on a daily basis, whether it's in her preschool or through early intervention or through visiting teacher service, is having those signs. So the child is really wanting to communicate different things, whether it was foods or toys, and the mom would ask, you know, what's the sign for this? So we communicated a lot via WhatsApp, and then I ended up photocopying a book for her, sent it out from my town at 4 o'clock one day, and she had it in her hands by lunchtime the next day. So she was able to look up the signs and, you know, be able to have communication ready for her daughter. So that was a really nice thing. So just some conclusions based on this, going from the touch, the face-to-face, to the remote learning. Even though we can't meet with people face-to-face at the moment, and we don't know when we can, there's still a lot we can do. The parents really want to teach their children from home. They just need some support, and they just need some ideas, and they will run with it. But I think the difference in what we provide as, you know, as an outreach service for deafblind is different than what the other, you know, therapists and the other people who are supplying input for them are providing. The really specific recommendations that, you know, focus on where they're at the moment, and that they're considering their hearing and vision impairment. So I think it's an important thing to say, not to blow ourselves up, but I do think it is a really specific service, and it's really important that we've continued this for parents. But we're looking at areas beyond communication. So it's feeding, it's behavior, sensory, physical, dressing, cleaning, you know, playing with their siblings, which they've been able to spend a lot of time with. So yeah, so now Heather's just going to talk a little bit about some training that we've started.
Yeah, so for the past year or so, we've been working on a training course in deafblindness. And I suppose with the lockdown, we've had time to actually complete it. So it's 5 modules on different sort of areas of deafblindness. And initially, it was going to be a face-to-face training that we had planned. Obviously, with the restrictions in place, we're unable to do that, but we've started implementing this with our staff in the Anne Sullivan Centre through Microsoft Teams, and it's worked really well. We've, I think, done 2 rounds of the training with our staff already in the last month or so, and we are starting to open it up to professionals in other services. So we're reaching, lots more people than we probably would have done, doing face-to-face training. We've had people logging in from all over the country. We've had staff logging in, from work or at home, so they're able to access our course very, very quickly. So that is something we're really pleased with, and a really good sort of outcome of the lockdown, I suppose. And then just looking at what is next for us, we are looking at how we can reopen our services. So we've established 3 subcommittees. So there's a subcommittee for residential, one for day service, and one for the outreach, which myself and Deirdre are part of. And just keeping up to date with HSC advice. They've sent out a lot of checklists that we have to go through, a lot of safety items that we have to adhere to. So while we're doing that, we're continuing to offer support and linking with other services. We will continue to do remote service for, as long as we need to. There might be parents that might prefer this, to do remote service for a long time. So we're going to be very flexible and adaptable, and things are changing every day over here, changing every week, really. So it's really important to think outside the box and be as flexible as we can. And each family will be different. They'll want different things and need different supports. And that is it from us. Thank you for listening. If there's any questions, there's a few popping up in the chat there.
Yes, I think what I might do, oops, sorry, I muted myself. No, I didn't. I think what I might do, Heather, would just put up our information, and we'd love to take some questions. And what I might do is take it off screen sharing, unless you want, maybe everyone wants me to leave the information here for a moment, and we'll just go back and look at some of the questions. There was one about where is it?
Loads of questions popping up, which is great.
Yeah. To add to Melissa's question, sorry, let me just get to Melissa's question.
There was one on the apps we've used, and I cannot think of any specific names of the apps, but I did say we could send out a list. Or if people want to take down
our email, I have a list.
I couldn't think of any the specific apps names that we use, but we do have a list somewhere as well.
And someone was asking about the lids. Oh no, they just made a comment about the lids. Do we know if families? This is Rita. Do we know if families? Where did it go?
Sure.
I read it and then it moves. Where did it go? Do you know if families are supporting each other now or less? And Rita, to answer your question, when I was doing webinars and setting up webinars, I actually grouped together parents that had children with similar needs. So the parents didn't know each other before the webinar, and obviously they were okay with doing this. They were accepting of it, and we actually had some wonderful conversations. The parents could be in 2 different parts of the country, but their children had similar needs. So the things we talked about, the topics, they related to both of them, and they actually shared as many ideas with each other as they did with, as I did with them. So I've been trying to do that with anyone who's been, interested in that. So as far as beyond us, if they've been contacting each other, I'm not sure. We do have a charge group that has their own private page. So I think families might be using that as well.
I actually just see a question pop up from
Yeah,
Liz that
great.
I find very interesting, because I was thinking something similar. In Canada, one of the reflections, or one of the phrases we've been using, is 10 years progress inside of a week. Basically, we were all forced to step into the future rather quickly, whether we liked it or not. And it does come back to this question: what do you think we will be able to take forward from here? And what are the pieces of our work that we're able to drop? I actually think there might be some things where we can literally view this very positively.
Mm-hmm.
Is there anything where you believe this is something we used to do, maybe it's time to stop doing this? Do it differently?
Yeah.
Definitely, definitely. I feel like the time that we spend traveling
Yeah.
can be used so much more wisely. But I think if we can reach people in different parts of the country all at the same time, like we are right now in different parts of the world, it's a great use of our time. And I think sharing resources is a fabulous way to do that.
Yeah.
I really enjoyed your comment, actually, about the fact that you save time by not traveling. And I've realized you save money by not traveling. And suddenly
Absolutely.
there are pieces of budgets available that we can suddenly allocate differently. I think that that's an interesting one to hold on to as well.
And we understand, like, there's other countries that are obviously much bigger than us, and we're very small, and our services, like, we don't have as many service users as other people do. So it's all relative, but it has been nice during the week to hear about how different people are doing it in the various countries. But time and money are an issue for everyone. All the time.
There's a couple of other questions which are really interesting. We've discussed this before. If we use simulation experiences or use of low vision goggles in our training, how will we share these experiences online? How can we provide this virtually? We were just discussing this during the week because we were doing the training. So yeah, there's different things. We told the staff, if they're living with somebody, they can practice doing some of the simulations with the people they live with. And Deirdre did a really good simulation where she had some letters on the screen. She was sharing her letters on the screen, and then we asked the staff to get some cling film from their kitchen and sort of look through the cling film, just to sort of create that experience of visual impairment. So I think it worked, and yeah, it was a way that the staff could interact with the presentation. We have tried to make the presentations as interactive as possible. We've posed questions, we've posed activities, like little activities. So you are kind of limited, I suppose, online, but I think we've tried to include as much as we can,
and I think the videos we've shared to point out some of the strategies we're talking about have been really good, because then we don't need to be in the same room. We can share what's happening in a classroom or in a center somewhere else. And so the use of video has been nice too. It's given other people other examples of what we're talking about. But it's challenging because we're so used to being, even now it's challenging because I love, seeing the reactions of people when you're presenting and not just staring at a screen all the time. But that feedback that you get from people, when you're presenting is the same when we're doing training. We rely on that feedback, and when people are following you and not following you, when to sort of go back and say, I think I need to go over that again. They didn't catch that or whatever. So we do encourage the staff that we're training to really, use the chat like we are now. And if you have questions, or if we pose a question, type it in the chat. It saves time. But the simulation part, it's hard. Yeah.
Definitely.
I think there's another question about the number of people who are deafblind. This is a huge issue for us because deafblindness isn't recognized. That we've gone to the Central Statistics Office to get numbers. So basically, we did a survey of 2014, and we only had about 100 people respond to it. Then we went to the CSO at the same time, and the numbers for people who on their census ticked that they had a hearing and vision impairment was somewhere in, was it 1,700, Heather? 1,200?
Yeah, it was.
Something like that. And then
yeah.
if we added hearing, vision, and one disability, those numbers were 10 and 13,000 for, say, the 2016 and then the 2011 census. So obviously our numbers, they're very skewed. We don't know if it's just the people that are taking hearing and vision have just mild impairments and are getting on fine. But we would only have about 200 in our database, and like I said, about 120 that we work directly with. So the numbers are obviously not the same. So we're working on the awareness piece. Like I said, Louise, our advocacy and campaigns officer, is really working with government to try to raise awareness. And she goes into hospitals and she does an awareness program in hospitals. We go into schools. We do, we're trying to do lots of awareness to try and, get more recognition.
Yeah. Is there another question? Where is it gone? Families who are not so tech savvy, and would they get left behind? I think we've tried to contact the families as much as we can through phone and email, and we are actually planning to make some materials for a lot of the families that we can send out, so actual physical pieces of communication, so boards, schedule boards or tactile symbols. So that is something we're probably going to work on over the next few weeks.
Actually, Heather, I wonder, I was thinking about the comment I made earlier about the time and money we save. I don't really think that we are saving time and money. I think that what is happening is that people are strategically allocating where there is need. I find that it may actually be exactly the opposite, that the people that are not that tech savvy, the people that are further away, the people that are more impaired are the ones that will benefit from the time and money that we save with the people that can do this by video conferencing, that can do this in a more accessible way at a distance. So I think we will just have as much work now as we had before, but it will be redistributed and potentially in a more useful way.
Yeah, that'd be great. If that was
and
the case.
and in a way, I suppose everyone has the same issue. We have where we're at the mercy of who responds. Like, we're sending out information all the time and sending out, requests for, if people want webinars or if they want one-to-one consults, but we are at the mercy of who responds and who wants, wants the support. So we actually don't know if the people who aren't responding are doing well or not, sometimes. So it's hard to, it's hard to gauge. It's hard to gauge.
Definitely, yeah.
Any other questions?
So.
Someone's saying that we need to encourage social workers to record deafblind in their system.
Yeah,
absolutely.
I have a curiosity question for an observation that I made in Canada, and I wonder if this happened to you as well. In the rehabilitation system for sensory loss, being visually impaired or having a hearing loss will not kill you, right? That's sort of the perspective of the health system. And so we have and had big staffing problems in long-term care during COVID. And so many of the rehabilitation professionals were reallocated to work in environments where there was need. And so sensory rehabilitation kind of dropped down a bit for a period because we were trying to keep people alive before we were trying to keep people from social isolation. Of course, social isolation is just as dangerous. It's a risk factor for mortality just as much as smoking. And so I was wondering whether you had similar experiences in Ireland or whether you remained more protected.
So I suppose in other organizations, they would have been redeployed to contact tracing, things like that. But for our work, we weren't. We're the only two people. And we don't directly, I suppose we don't directly work for the health service executive. But I do know people that were definitely redeployed from a non-essential, we'll say non-essential service to a more essential service. But that's all finished from what I've heard, and that's all finished now. Those people have now returned to their jobs and they're coming back to work.
Yeah.
Ladies, it
Any
was
other questions?
fascinating, fascinating presentation.
Thank you.
If you still
Thank
have
you, Walter.
leftover comments or things you would like to do before we
Just
run out
trying
of
to
time.
scroll. Yes.
Yeah.
I missed anything. Someone, please raise your hand if we missed anyone. I think we've training. Someone asked if we were the training was available. So right now it's just for our staff, the training we developed and the professionals that we work with. But you never know.
Yeah.
Watch this.
Watch this space. Exactly.
Big thank yous to Ireland.
Thank you.
And we wish you well.
Thanks very much.
Thank you, Walter, for setting this up, and for everyone that's organized this conference. You're doing a fantastic job, and
amazing.
It's really great for everyone to access this.
We'll give you all a 15-minute break, and we will be back on the full hour.
Bye, friends.
Bye. Bye.
Everybody, for those of you who've just joined us, please note that we are recording our sessions today, so ideally they will also be available on the website of Deafblind International relatively soon. We've been trying to make our sessions as accessible as possible, and you can see that we do have sign language interpretation, but we were not able to find the money or the volunteers for live captioning. So we're working on that for next time for sure. Now, for those of you who would like to have better access to the sign language image, you can actually go to the view option at the top right corner of your screen and select the share screening option, where you can make the image of the sign language interpreter larger and easier to see. We have Lear and Robert with us today, who are both going to interpret for the entire day. Just in terms of the rules of engagement, you will have noted that everybody's cameras have been turned off and everybody is muted except our speakers, so we can focus on the information that they are going to provide to us. If you're unfamiliar with Zoom, I will direct you to the website of Deafblind International, where we have some instructions on how to best use Zoom. You will see that most of our presenters are actually presenting in teams. I'm not sure, Simon, whether you have somebody with you, but usually the co-presenter can focus on what's going on in the chat. We encourage all of you to use the chat function to comment and to ask questions throughout and after the presentation, so you can engage with the speaker. For those of you who are using social media, we encourage you to let the world know what we're doing. If you are on Twitter, our hashtag for the week is DbI webinar, or you can tag at DbI_connect in order to link to Deafblind International. All right, so we're good to go. Simon, what do you have to say?
Well, good afternoon and good morning and good evening as well from wherever you are in the world. My name is Simon Allison and I'm from the UK. I'm from a part of the UK called Cornwall, which is right down at the very tip at the end of the country. And I've lived here around 6 or 7 years. It's a holiday sort of location, although in true English sort of style, we only get very limited sunshine. However, it is sunny today. So I'm quite familiar with the working of Zoom, and I'm sure for all of us it's been quite an education. Little did we know at the DbI board meeting over in Moscow a couple of years ago, when we started to sort of use Zoom for our board meetings, how prevalent it would be in our lives and what a big part of our lives it's become. So, well, for today, I'm just going to introduce myself with the share screen. So there we go. So today, I'm going to talk about the Sense Cornwall Got Group Virtual Activities Program. I have a couple of shared screens to show you, so hopefully that will all work okay. There we go. I'm going to introduce myself and my various roles. I'm a very busy person. I'm a very busy man. I have kind of 3 different roles in my work profession, and also 4 children, 2 of those under 5. So that's also been a challenge. So for DbI, I'm very proud. It's a great honor to coordinate the youth project. We've been running activities now for about 6 or 7 years. And I also I have my own charity, which is called Drama Express, which is a charity for young people to access the performing arts. It's something I'm really proud of, to actually have my own charity. It's always been an ambition of mine. And the kind of the bread and butter of my working life is to work for Sense, of which I've done now for 20 years and had many roles within Sense. So we're going to move on there. So for the last 12 years, I've run a project down here in Cornwall, and it's a short break service, and it's an acronym. It's called the GOT Group, which stands for Get Out There. Which is it's a project for young people aged 11 to 18 years. The criteria to access the GOT group is a young person with sensory impairments, including deafblindness, with an additional complex need. And as I said, GOT's been in operation down here, commissioned through the local authority for 11 years. And at present, we support around about 25 young people.
Simon, just as a mini question,
Go
is
on.
it possible for you to go into presentation mode with your slides?
Oh,
to make
sorry,
it a little larger?
Oh, new show. Hey, how would I do that? Is everybody seeing the?
We see.
Yes.
Yeah,
you want to see me as well, don't you? Oh no, you can see me.
We want to see your entire slide only. So
hang on, you do, yeah.
At the bottom, you know where it says 69%, where you can make things smaller or larger? On the left of that, there's a symbol that looks like a little fork.
Oh yeah, hang on. So this is right down on the left, you say?
And I'll go a bit further down to your right where the mouse is. Take your
yeah.
A bit further over.
Yeah, and it's
the symbol right next to the minus sign. Right next to it on the left of the minus sign.
No, I'm over, so on my bottom screen with the new share, the participants. Are we on this part?
I'm in your PowerPoint software.
You are, yeah. I mean, this isn't essential of the PowerPoint, but as you say, it kind of does link the.
You can also go to the slideshow option at the top and select present. There is.
Yeah, Skype Office Skype for Business or Office Presentation Service. I've got present online.
Let's see. Where do you go on here? I've never used that option, but
so at the moment it's myself, isn't it?
From current slide. There's an option that says from. The second one is from current slide. Click on that.
Yeah, yeah.
There we go.
Yeah. Apologies. So, right. Okay. So I'm talking about the GOT group, and the sort of services we offer. I'm just thinking now, how do I get into my slides to go on to the next one? Like that. That's it. Great. Okay. So as I was mentioning before about my 3 projects, very briefly there, the Deafblind International Youth Network, the Drama Express charity, and the Cornwall GOT group. Sort of late February, when COVID started to appear in various places around the world, we had sort of numerous plans. With Deafblind International, we were holding a activity over in Washington, DC. With the drama group, we were sort of in the middle of a performance out and about in the local community, something called a pantomime, which is something that's done over here in the UK. And also with the Cornwall GOT group, we were engaging in our sort of weekly activity program. So with all these 3 work roles, I had some numerous hours of unplanning. I spent my working career planning activities, but I've never really unplanned activities, which was a great education. Obviously a very time-consuming to unplan things and to make lots of different rearrangements. So with the GOT group, the date was March the 15th, 2020, and we had a very large activity planned in a big hotel locally down here in Cornwall. This had taken, again, quite a few months to plan. We had over 100 guests. We were going to deliver a award ceremony. So there were some decisions to make as to whether to go ahead. This was right at the very start of the COVID outbreak. And it seemed quite unusual at the time to say to people that we would have to postpone. There was many reasons. We are working with a vulnerable group. We're unable to screen attendees. It was taking place in a very public hotel. There was no, the word sort of social distancing had never occurred to anyone. It not things like this sort of hadn't really happened. So we actually postponed that event. So in a way, it was a time we had many questions to ask ourselves with the GOT group. Could we actually continue as a group? It's funded through local authority funding. What were the wishes of the funders? Do they want to sort of carry on with things? Were we going to suspend our service because we were a face-to-face group? What would the role of the volunteers be? We have a fantastic team of volunteers who engage with the young people, and what would they be able to do if the service was to sort of return in a completely different format? And if we were going to use sort of a virtual activity program, what about the online security and the various apps to use? And also, probably the most important factor was engaging our young people with their complex and sensory needs. How could we still achieve this? So we decided to launch our virtual activities program. There's some dialogue up here that's brought up. We wanted to deliver everything we do in a face-to-face capacity, but it's obviously how were we going to transform it into something that is a virtual means. So we began our virtual activities program. That should actually, the date there, that should be the 30th of March. And there's a few numbers here of how many young people attended. It only goes up to the 13th of April, but following that date, it was fantastic, and we were delighted that we engaged everybody on the program. There's a couple of photos coming up here. So I'm now going to go on to some of the activities that we delivered online. We're talking about accessibility with the sensory impaired young people and how we could actually engage them into the activity program. We do, as I mentioned before, we do have a team of volunteers, and they joined us for our online activities, but we also had key workers who were working with the young people. So they were able to engage the young people into the actual virtual workshops. There was quite a bit of tactile information to pass on, but it was something, again, with the planning, it wasn't simply saying that we're going to be doing an activity this day. We had to think about the 24 young people, all with individual needs, who were going to access the activity, and to ensure that their communication needs were met. We obviously weren't meeting face to face, so there were so many different areas to think about. As the young people were vulnerable, many have support staff who were still working with the families, so we were able to engage the support staff to use various means of communication, whether it's sign communication or hands-on signing or deafblind manual. So we still reached our target and our aim, which is to continually engage the young people. And it was also about maintaining the friendships. Now, the great advantage of using technology and working with young people, I'm sure you'll all agree, is the fact that the young people are very savvy to using technology. In fact, there was often occasions where we would consult the young people into the use of technology. And as you saw there with Walter, I'm still learning about virtual sort of programs. And I think every time I engage in a Zoom session, I find a new keyboard button that I can use to draw my attention to something that works. So it's like everything, it was very much a learning process, and it was sort of learning online with the young people. So now I'm just going to talk a bit about some of the activities that we did. So I was mentioning about setting up this program of activities, which we were so enthused to do, because it meant we were still engaging with all our young people. They could maintain those friendships, and they weren't disadvantaged by the effects, the traumatic effects of COVID, and we were still able to function. So once we sort of worked out this was something we could do, then we just went at it. You know, this is going to be a success. So I'm going to this is just a sort of highlighting a few of the activities. Prior to setting up the young people through virtual means, we engaged with each family to download the app. Again, this was I can remember this took the best part of every hour of a week, speaking to individual families and running through the process of downloading the Zoom app and making sure whatever they were working on, whether it was a tablet or a mobile phone or onto a laptop or other means, I'm sure there was other ways we managed to get people on. But and then we also ran some tester sessions similar to this presentation, just to see if everything was working. So let's have a look at some of the sessions that we're able to offer. And I must say that you'll see some names up here I wanted to name check some of these people because they've just been fantastic. They've all offered their services for free, and we are we feel sort of very humbled for the kindness they've shown to work with the group and the understanding of the young people and how to engage the young people. So dance and Zumba is something that's it's great fun, and it's we tend to run the sessions. I'm sure you're going to ask about how often we run our sessions. These take place during the week, and we're actually going to move over now to some after school activities, because a few of our young people, perhaps 50% now, are returning back to education. We haven't made that decision yet about meeting up, and it will happen, but it'll be different than what it was beforehand. We're all having to learn how to adjust our lives. There's such a big change. So as I was mentioning, the dance and the Zumba, it's a real great way to engage the young people. The young people were given the opportunity to choose what they would like to dance to, and it's a great, fun, engaging activity. The yoga and the mindfulness. This was kind of a regular activity that started off our daily sort of sessions, where the young people had a bit of time to sort of think about where they were in life and the effects of COVID. And we didn't approach the emotional implications sort of head on. We waited for the young people to have that time to chat to their friends. I think now that we're starting, well, in the UK, we are starting to look back at that time when we were all in a bit of a crisis, and we didn't know what was going to happen next. And there were a lot of emotional implications for the young people, that insecurity, the apprehension, the anxiety, all thrown in there. So we had this sort of introduction session, tied in with a bit of yoga, but it gave that time for the young people to chat about their feelings, which is really important. We had a plan to each session, but we really wanted to sort of have that opportunity for open conversation where we could talk about our fears, and I think that was what was so important. So yeah, there's a few more activities there. We use many ways of making things as tactile as possible, which is the nature and the most important thing in the group to ensure we are sort of accessible. We had some regular activities like our BSL signing class and some Spanish lessons, drumming and percussion. That's very tactile to feel. We did that yesterday, to feel the vibration of the musical instruments. We work with the Sensory Trust, which is a national organisation here in the UK. It's furthering our expertise to working online, and the Sensory Trust have been brilliant, really, in working with the young people. So I'm just going to stop the screen share so you can see me, I think. Right, so hopefully with this screen share, I'm going to show a short film. Although, here we are. So I'm now going to click on to a short movie that, now this was something that we actually did together. It may look like a promotional video, but this is something we worked on as a group. Film production was something that we developed an interest in. We wanted to, as a group, we wanted to show everybody what we've achieved. It was all about kind of, look, this is what we've done. This is what we've been able to do in such sort of difficult times. Hopefully this will work. I'm pretty sure we aren't going to get, there isn't any sound anywhere, and it is captioned. There's just a bit of funky music, so this should work. Walter, is this okay? Is it going through?
It's going through. If you can zoom in a little bit, because it is, if you can make it larger, that's always better.
Yeah, I can, yeah. There we go.
Ah, perfect.
Oh, I got some music.
Just to confirm, Simon, there is no sound, right? Because you have no sound on the video.
There we go. Okay. So next I wanted to cover just a little bit about safety and the safeguarding of our young people. I think this is an important matter if we're working online. It was very important that we ensured that everyone was safe and that the vulnerable young people that we are working with in any environment, safety is very important, and protecting the young people. So obviously this is even more of a factor perhaps for working online. So with our volunteers, we send out some training packs on the online security. So we were all, oh gosh, oh, I've got some music. I've got some background noise. Oh, hang on a minute. Sorry. Right, I got some great background noise. I think with the last clip, it went on to another YouTube. That's great. Okay, right. So, yes, looking at safety, don't know if you're aware, there is the Zoom sort of membership, which does offer more features. One of those is the way that we can have a waiting room before anyone accesses our online activities, so we can ensure that the people who are joining us are part of the group, and that no one has access who is not really sort of we know who's coming on there. And it was important that we sort of continually monitor the use of the young people when they're accessing the internet. So we did, although we are a service that provides a short break, the GOT group is a short break service, and our commissioning, our funding ensures that parents and families have a short break whilst we support and engage the young people. It was important that there was someone there to assist the young people during their access to the activities, just to sort of keep an eye out there, just to make sure that everything is working okay. And we had done the sort of necessary training. We did actually give some information to the young people about their own sort of safety, and they're aware through their education facilities, but it was also really important that we passed on, and we had run some sessions on internet safety with the young people. I'm going to go back to the screen, my PowerPoint now, see where we're up to here. Oh, slide's not moving. Oh, there we go. So that was one of our activities. I just wanted to show this was an activity that we did together. It might seem like something, it's actually a bird feeder to hang up in the garden. I wanted to talk about this because it might seem such a simple activity for a group of youngsters, but it was just fantastic. It was really, the activity was covered a whole sort of session, and it was a very tactile. It's actually a breakfast cereal put on a piece of string here and hung up in the garden. But we also had to make sure that our young people we were supporting had the materials to use for the activities. But this was great, just a little simple sort of craft activity, and then followed up by hanging out the bird feeder in the garden there. So that I was mentioning before about the ground rules for our youngsters, I think it was quite important. It's something that's new, and they are young people, and it's similar to an educational environment, so it was important to set a few ground rules. Obviously, we didn't want to be too strict on everybody. I just want to move over now. We held an awards ceremony for our young people, and this celebrated, we do this every year with the GOT group, and this celebrated their achievements over the past year. And this was the activity that we were planning until obviously COVID appeared and we had to cancel. So we did all this online, and we managed to transfer our awards ceremony to a virtual ceremony, which worked, and it felt like a very special occasion, which was what we intended in the first place. So I've got a bit of feedback here from parents and families, and it's always important to know the difference that you are making when you are providing a commissioned service. And it was great that we sort of achieved everything that way, and especially in the way of giving parents a bit of time, a couple of hours, that they can do all the jobs they have to do, and importantly to concentrate on the other siblings in the house. We really did achieve that. It was very heartwarming to myself and the rest of the team to look at this feedback, that we'd sort of achieved what we set out to achieve when we realised we had to go virtual. And it has been a real team, so the volunteers have assisted online and have provided some wonderful sort of support to myself, and without the volunteers. And we use volunteers obviously when we're out and about in the community, so we've been able to utilise a lot of their skills online. And we got some feedback as well from providers who've joined us for the activities. And I think across the board, people have said that you've got something that's quite remarkable here, that's really sort of working. You've got a group of young people who are able to continue those peer group friendships, and it's been really important to us. So I think time-wise, I've kind of just done quite well. So there's my details here. That's the email. We've produced a best practice document, which is it's really the story of the virtual activities program. and kind of from, I won't say finished because we're still in the UK. We're very slowly coming out of lockdown. And although this is some a program because of COVID, I think that beyond when sort of that time passes, we will still do some Zoom sessions. We will still do a bit of online work. We may do this for young people who can't make the sort of face-to-face activities. It might be an option that way. We might hold our young persons meetings virtually as well. So there's also progression that way. Just going to stop screen share. There we go. So are there question-wise, will this come up over the chat? There's 27.
So your questions would show up in the chat. You just have to scroll down. For example, one question is, how do you modify your activities for individuals with diverse communication needs?
Yeah, so mentioned before, let's look at an example of, well, deafblind communication. I'm thinking of one young lady who she has a, I'm going to show actually, we did some, no, I was just going to show something there. We did some virtual activities. We actually went out and about. We went to a theme park on a roller coaster, and it's demonstrated visually on the screen, but we had the communicator guide using some hands-on signs with the young person of actually sort of going up and down on the roller coaster. When we did the bird feeder, again, the person could use the sort of sign. When someone is speaking using the Zoom, then this will be communicated to the young person through signing that person's name, and they could interpret that information. So yes, I think our young people are great at understanding each other's needs, and that's sort of really, really good that everybody has a fantastic amount of patience and understanding, especially with their peer group. Here we go. Right, some more questions. Another question, Walter.
Do you have access to the chat yourself, or would you like me to read it?
Oh no, I have, but there's a lot there.
Well, it's only the stuff at the very bottom that applies to you.
Oh yeah, yeah, of course, yeah. Oh, look, yeah. Mm.
So anything that starts after 8 o'clock my time, or you can see the timestamp.
Yeah, that's all right. I'm going up there now. Yeah, there's a lot of access. So it's a question about very complex needs, young people. It is because you've not. It's the tactile. As we all know, we've had to make so many sort of adjustments, and it is about working with sort of everybody's individual needs. And that's a really good question. I've started off an activity and thought this is I wouldn't say it's not working, but it's something that's not able to sort of engage everybody. When I planned the activity in my head, I was thinking of so many ways to engage that person and trying, and it sort of, I won't say it didn't not work, but it was a lot more difficult than I actually sort of thought. And then there's been other activities that have been just such a huge success, and it's sort of worked really, really well. It's all about sharing and passing on that information, isn't it? in that way, and if we can, we're kind of in virtual interveners. That's a great way to sort of define it.
There's an interesting question about whether your best practice document is available online.
If people were to email me, I can send that out if that's okay. But I have got that document. It's not available online, but I know it's. I'm very happy to sort of share that. So there are other GOT groups. There's a question there about the GOT group. There are other groups operating throughout the UK. With the GOT groups, we all provide, the common theme is we provide short breaks, but sometimes in different sort of capacities how we actually deliver that. Some GOT groups may only do an activity once a month, and they might do activities for very young sort of children. We work with 11 to 18 years, so it is an age group where they are able to sort of access the internet and to do things virtually. But and also I feel that we've all learned so much about virtual means and virtual programs. Thanks, Louise has just mentioned the other GOT programs there. Righty-ho. What training do volunteers receive? Very good. Well, we've done some sort of regular training. We generally have a mandatory program. However, we've had to sort of make quite a few adjustments. We did training on online safety, but we've also done some sort of extra training that's been available through Skills for Care. And a lot of these focus on sort of anxieties and the stress management during COVID. It's a very specialist training, but it sort of really helped with just what we're going to sort of expect and how to manage a lot of the anxieties. In a way, it's sort of mental health training during a crisis sort of situation, and that was very it was really something very beneficial to the group, because you really don't know. I can remember at the start of our program, I didn't know what to expect. I was really nervous myself. I didn't know whether to be really honest. I didn't know whether to mention what was happening with COVID. I didn't want to frighten the young people, but I wanted them to feel that we were supporting them emotionally. So we waited for the young people to take the lead. Just scrolling through the questions. If there's any further questions, then please do contact me via email. Right, okay, so well, I hoped you enjoyed my presentation. I used to, quite a few years ago, I used to do some radio work, and this is very much like being on the radio. You can't see your audience, but I hope that it's been beneficial to you all, and that there's been some sort of, I think I had a very honest approach to how the services we've sort of delivered. But thank you very much indeed for watching.
Thank you for joining us. I encourage people to email you. I saw your email earlier, simon.allison@sense.org.uk. People can email you their questions directly if anything comes to mind. All right, we will wish you a good day over there in Cornwall.
Thank you.
And I will send our sign language interpreters and the rest of the gang onto a 15-minute break. We will see you again on the full hour. Bye. Out by my little housekeeping notes. For those of you who have just joined us, please note that we are recording the session and we hope to have it available on the website of Deafblind International relatively soon. We've been making various offers for efforts for accessibility, and you can see that we have international sign language interpretation going on. Shout out to Robert and Lear today for interpreting for us. However, we were unable to provide live captioning today. We could not raise the funds and find volunteers to do this, so we're working on that for next time. For those of you who are new to Zoom, you can go onto the top right corner of your screen and select under your speaker view an option where you have side by side. This will allow you to make the image of the interpreter a little bit larger if that is what you would like to prefer. In terms of the rules of engagement for today, you've probably noticed that your cameras and your microphones are muted. Only the speakers have access to the screen and their camera, so we can focus on them and the content that they are presenting for us today. If Zoom is still new to you, there are some instructions on the use of Zoom available on the website of Deafblind International as well. Most of our presentations are given by two people this week. We have a primary and a secondary presenter. The reason we have asked for that is because we encourage people to use the chat feature in order to pose questions and comments on the content. And so this way, one presenter can focus on their presentation while the other one has time to survey a little bit of what is happening in the chat and maybe provide some answers as we go along. If you're on social media, I encourage you to tell the world about what it is we're doing. Specifically, if you're on Twitter, use the hashtag DbI webinar, and you can tag at DbI_connect if you want to connect with Deafblind International on Twitter. All right, now, the next item on today's menu comes to us by Amanda Mesco and Crystal Pigeon Way. Ladies, please activate your microphones, your screens if you are with camera. There you are, excellent. And you have control for the next 45 minutes until we give our sign language interpreters their next well-deserved break.
Thank you so much, everybody, for joining us. Just let me start the presentation here. There we go. Thank you so much for joining us. My name is Amanda Mesco. I'm here with Crystal Pigeonway. Crystal is going to be supporting in the chat today, so if you have any questions, please feel free to reach out. I have worked with Deafblind Ontario Services for 15 years. I'm currently the Community Engagement Manager for the West. Crystal Pigeonway has worked with Deafblind Ontario Services for 2 years. She's the Assistant Community Engagement Manager for Sudbury North area. She's worked in social services for 12 years. Today, what we're going to do is we're going to talk about sort of our experience through COVID, looking at both organization and intervener resiliency. We want to start with a little bit of information about us first. Since this is an international presentation, we want to make sure that everybody understands where is Ontario and what do we do. So, Deafblind Ontario Services is based out of Ontario, which is within Canada. And what we do is we provide services for anybody who is deafblind, and we do provide funding through the Ontario provincial government. little bit about Canada and Ontario with regard to our populations. So Canada has a population of about 37.5 million. Ontario is about 14.5. When it comes to the deafblind population, approximately over 1% of Canada's population and Ontario's population are deafblind. So in Canada, that's 466,000, and in Ontario, it's just over 211,000. Deafblind Ontario Services actually started in 1989. A few parents lobbied the Ontario government. They wanted to find funding to secure community-based supports in a living program. And in 1989, we were incorporated as a not-for-profit organization. We currently have residential services where 3 or 4 people live together. 69 individuals have that service. There are 17 homes and 8 apartment programs. We also have a community services partnership program. We support individuals across the province who have other services with training for deafblind interveners. Our funding is from the Ministry of Community, Children and Social Services in Ontario. The funding for Ontario and Canada is not a national strategy. The funding for Canada is not across the board. Each individual province and territory allocates funding differently. And so Ontario actually has a distinct funding strategy for intervener services under the MCCSS umbrella. A bit about us. So our mission and vision is always a great thing to share with everybody. Deafblind Ontario Services supports individuals who are deafblind to live and thrive within the community. And we have a vision to enrich lives one touch at a time. Value statements were decided on by the people we support, the interveners, and the management team. Things that we truly believe on is that we are passionate, we are collaborative, we are leaders, we are resilient, and we are limitless. So getting into the pandemic plan. So before COVID, we did feel that we had a very solid plan. And to be honest with you, it really was a solid plan. We created this plan in 2007. It was based on the SARS and H1N1 outbreaks, which obviously are not even close to where we are with regard to the COVID-19 pandemic. We made sure that in our plan, we prioritized direct service, the well-being of people we support, and made sure that daily living activities, whenever possible, were continued. We made sure that we had a high level standard of cleanliness, healthy food options, medications. Universal precautions were always in place, and strict hand washing precautions when entering and exiting the locations were implemented. We also had a communication process where we actually shared information from the public health units and World Health Organization to the team. We had a pandemic team in place to ensure that communication went out to everybody. We had an active tracking for anyone diagnosed, and it was reviewed daily. We did regular check-in phone calls with all locations and teams. Families were contacted if they were able to care for their loved one, they were asked to do so. There were relocation plans in case of low staffing ratios. We were expecting a 20% decrease in staffing given any pandemic. Isolation plans for anybody with symptoms. Personal protective equipment monitoring. So each of the locations actually had a pandemic box there with PPEs available at all times. We did come to realize that maybe we needed more for a pandemic such as COVID that lasted not just a short period of time, but lasted an extended period of time. So that was the plan before COVID. So what happened during COVID? What we did here is we looked at what happened in the province and how we responded or what we did. So I'm going to walk you through a little bit of the actual day-to-day how things worked over the last few months, just to give you an idea of the decisions that we made and why we made them. So January 27th was the first positive case in Ontario. For Deafblind Ontario Services, what we did is we made sure there was communication across the agency that addressed the COVID-19 positive case in Ontario. It also outlined reminders of infection prevention controls and to ensure that clients and staff remain safe. January 30th, the World Health Organization confirmed public health emergency of international concern with only 3 cases in Ontario. We again send out communication to encourage universal precautions, and we actually implemented extra cleaning. March 11th was the first death in Ontario for COVID. On this day, we started out with increasing our cleaning and how we did that. We limited community access to the people we supported. We utilized universal precautions, which we always had, but we basically made them very accessible and knowledgeable to everybody. And we started stockpiling additional personal protective equipment. On March 17th, the Premier of Ontario declared a state of emergency. They closed things like schools, daycares, businesses, and non-essential travel. Between the 17th, we started limiting access to the locations, which means only essential employees or supervisors were able to attend. We closed day programs, we halted all community access, and all unnecessary personnel were removed from location. This did include limiting family and talking to family about whether they wanted to bring the person that they loved home to support them there. March 23rd, Ontario closed all non-essential businesses. This is where we decided to implement self-monitoring. We supported staff by helping them with what to do if you do get sick, or if somebody we support gets sick, so that's where the plans came into place. We actually started preparing isolation plans, so we contacted hotels, we made plans as to what spaces we could turn into private apartments, how we could actually, if somebody had a positive case and maybe their roommates didn't, how could we support them? We did cancel all public events across the province, and we actually started actively sourcing PPE, so personal protective equipment, and we implemented weekly check-ins with public health. So a little bit about public health. Public health is the Ontario supports for anybody with health information and/or care. There are 36 different public health across Ontario. So when you're an Ontario provincial agency, you do get a little bit of different viewpoints from each public health. So that was a bit of our challenge, and we'll get into that a little bit later when it comes to the testing. March 30th, closures for all outdoor amenities, including beaches, parks, and campgrounds was done in Ontario. We sent out letters to all employees, recognized them as essential service workers. Part of this is that at that time, people were actually being stopped or asked where they were headed, what they were doing. So this sort of gave them a little bit of, this is who I am, this is what I do. And, considering we're a 24-hour-a-day program, it was really helpful for anybody just to make sure that they felt safe and recognized. It also gave them a little bit of help if going shopping or into different stores, because other stores recognized letters like that, so that they could shop without having to wait in excessive lines to go into a store for groceries or other essentials. We also made cloth masks mandatory at that time. April 14th, they extended the state of emergency, and they also made a decision about long-term care and seniors' home cares that they could only work at one location due to recent outbreaks at facilities. So here in Ontario, we had a big challenge with long-term care and seniors' care homes having outbreaks. People were very sick, staff were getting sick, and people were dying. We, as a residential location, was unfortunately not included in that. And so we actually made the decision to protect the people we support that we would also implement this rule that staff could only work at one location within Deafblind Ontario Services, and they could only work for one employer. Previously to this, we had actually really taken a big step in making sure that we provide as many full-time positions with benefits as possible. So most of the people we had employed were full-time individuals with benefits, so it was a little bit easier on them. For the people who were part-time or working part-time, they did have to kind of make a choice between two different employers. To support that, we offered leave of absences to people who wanted to choose to work for somebody else. For those who chose to work for us, we were able to support them with an extra allotment of hours. That way they weren't losing any money by making a decision that way. April 24th, this was a really great day. Intervenor services was for the first time ever recognized an essential service by Ontario. And it was announced that essential service workers got an increase of $4 per hour for the time between April 24th to August 13th. And then if you worked more than 100 hours in a month, you also got an additional $250. Deafblind Ontario Services, we were very excited to announce that to everybody, that anybody who is working with direct service were able to get the Provincial Pandemic Pay. We also distributed cloth masks that we actually had our team making with filters and mesh bags to all employees to help. The pandemic pay didn't come through until June, but it's already rolling and they're all very excited and happy about that. So in Ontario, May 1st, they did start to announce that some seasonal businesses could open as of May 4th. So this is where we're starting to kind of let up a bit. Deafblind Ontario Services recognized our employees throughout the whole COVID pandemic with, special orders, cakes, cupcakes, treats, anything that each house or each person or each deafblind individual liked, we basically sent to the locations. This week, we actually gave gift cards to each of the staff, water bottles as an appreciation. And then we also put out signs that say heroes work here at the outside of each of the residential locations to kind of celebrate the amazing work they were doing, keeping everybody safe. May 9th to 14th, the province actually starts to begin slowly opening. Garden centers, nurseries, hardware stores, retail stores start street entrance for curbside pickup. You're allowed daily visits to parks again, which is great. We decided that we weren't quite ready to open up the people we support. The vulnerability and the health of the people we support was still very compromised, and having anybody with COVID would basically be detrimental to them. And so we still encouraged online ordering, curbside pickup for any house supplies. We also continued to restrict community access. They were absolutely encouraged to go out and enjoy the beautiful days. We finally had some beautiful weather at that point, to parks and or backyards and or any areas where social distancing was possible. May 27th, the Ontario government orders all long-term care residents and staff tested for COVID. So this is a bit of a challenge that we came into because we would love to have everybody tested in the organization. We are Ontario-wide. As I mentioned earlier, there are 36 different public health agencies. And when we called each one that we are connected with based on our regional area to say, hey, can we get tested as well? We did get a few different answers. So one location, they came in, they tested all the people we support, as well as all the interveners and even all the office staff were actually able to test over 2 days. Whereas other regions, they only were ready to test if you had symptoms. Basically, if you were presumed a positive case, and they wouldn't test everybody at the location, they would only test the person with the symptoms. So that was a challenge that we're still trying to overcome at this point, where every different public health area had a different set of parameters because they were at different points of testing. So some of the successes. We were really quick to start our pandemic plan. Restricting visitors, only essential employees, community access restrictions, reducing spread, and single location strategy was very quick and effective. To this day, we have not had a COVID-19 positive case, which is wonderful, and I'm gonna knock on wood so that we keep that kind of safety in place. We quickly reallocated the team. So anybody who was considered non-essential was obviously removed from location. And then we started looking at securing PPEs, personal protective equipment, donations. Some team members with great talent started sewing fabric masks for everybody. And we found very creative ways to support those in service. The quality of service was minimally affected, even with 45 employees or 18% of interveners on leave of absences due to COVID. Through amazing community supports, we were able to secure over 10,000 personal protective products and over 25,000 in financial supports through the COVID pandemic. When we found out that a sister agency was having issues with finding personal protective equipment, we were actually able to donate some of our supplies to them so that they had what they needed to be safe. Intervener services, as I mentioned before, was officially recognized as an essential service in Ontario provincial announcements, which is amazing. In June, all employees returning to work are now required to be tested and have a negative result for COVID. So anybody who was on a leave of absence, anybody who was working at another agency, who is basically ready to return, has to be negative before returning to a location. Prior to the pandemic, we were working towards creating as many full-time intervener positions with benefits as possible, which made the location restrictions achievable. With people being full-time, it really gave them the stability not to have to worry about having multiple jobs. We quickly implemented and required employees to work with one employer, even when the government had only included long-term care and senior care facilities at the time, but not the congregate settings or residential programs. For the future, so what do we think that we could do a little different or we could actually, grow on? We'd like to join public health committees to grow and better represent the unique needs of individuals with deafblindness and for those in congregate care settings. We want to draft a new pandemic plan and increase the level of PPEs to be kept on hand for the future. Strengthen our relationship with government, community organizations, working alongside other community organizations who have experienced outbreaks to share and grow our knowledge and learn from them as well. We began piloting virtual training to help reduce contact for future during onboarding between candidates and the individuals we support. So organization resiliency. What Crystal and I did was we went to the senior management team and sort of asked them a few questions, try to get their perspective on the COVID-19 pandemic and how we sort of reacted to it as an agency. One of the things that we talked about from our perspective was the reallocation of skills was essential. So collaborating, making our own fabric masks by employees and ensuring that we had adequate PPEs readily available when everybody was facing shortages was essential. So having people making their contacts, calling people, emailing, getting donations was phenomenal. What we did was we did weekend check-ins, so phone calls, which each of the locations when the supervisor was off duty. This really helped the interveners and the people we support to feel supported even on the weekends or on holidays. When we had our first potential positive case, we actually had 2 staff jump in their car, drive over 250 kilometers each to deliver personal protective equipment to make sure that that team had everything they needed to feel safe and have all the universal precautions they needed, even though it was a negative result. One of the interesting things we did was we made all memos accessible to everybody through their own personal devices at home, their cell phones, their computers, their laptops, through our training room. And so they were posted and the staff would get an email and they could actually log in and read every memo whenever on COVID so that they had access whenever they chose to. We actually successfully opened 2 new residential locations and 4 new programs during the pandemic. So we had already started building these locations and had plans to actually open in the spring. But luckily, due to an amazing team, amazing supports, we've actually already opened those programs and they have been a phenomenal success already. The senior management team met weekly to monitor all different information, whether it came to COVID, how people were feeling, what was happening in the agency, and where supports were needed. Key strategies for supervisors. The weekly check-ins and support from senior management team was ideal. It was something that the interveners and the people we supported really felt was important, and we felt as a team that it was very successful. Appreciation gifts for the team throughout COVID, things like getting them chocolate and coffee and thank you cards, water bottles, gift cards, special deliveries, having theme weeks, all made it a little bit easier to support the people we support every day. Communication, being open and honest with the team, but with the management, the families, and the people who receive support. Encouraging self-care. So with the Employee Assistance Program and free crisis training available for essential workers, that was ideal. It was a very stressful time for interveners to make sure that they knew that there was support out there for them. Weekly communication with local public health and sharing of that information across the agency. We made sure that we were always in contact with public health, made sure that we were always asking the questions, asking about screening. We even pre-asked questions, what if? What if somebody went to the hospital? What if somebody needed tests? What if somebody needed to see a doctor? And we were prepared so that when those things happened, we already had a plan in place. Intervener resiliency during COVID. So what we did here is we reached out to probably 10 different interveners just to kind of get their anecdotal support and see what they think. This is one of our interveners, Ashley, who is sorting one of the masks that we made, as well as the water bottle. This is an example of one of the signs that was made, and water bottle and masks. From the intervener perspective, so of the people we talked to, there was a general fear of exposing vulnerable individuals and their own personal families to the virus. They did have challenges with self-care and work-life blend. It was very rewarding to know that they were doing everything to keep everyone safe. So although sometimes the masks were not easy to wear, they felt that it was so important that they were doing their due diligence. Fear of communities returning to normal before there's a vaccine and a cure. Supervisors were a big support, as well as they had a lot of peer-to-peer support. We kept the environment fun and positive to help interveners stay focused. Working at one location only during the time helped people feel safer. The need to continue with safety protocols, even as restrictions are lifted. So the recognizing that although there's only 200 new cases in Ontario a day right now, it's still necessary to keep ourselves, aware of how to keep the individuals we support safe. They needed to have a lot of out-of-the-box thinking to keep individuals engaged and supported, help them understand the changing world. This was very challenging. We support a lot of people with cognitive challenges, cognitive deafblindness, and helping them understand why, they don't get to go to Tim Hortons or go out for their groceries or go to their jobs or see their families was very difficult for them. And although they are doing phenomenal and they are definitely the heroes of all of this, there definitely was some challenges and definitely a hard time understanding why. Intervener strategies, so things that help them to be successful during COVID. Creating the fun and engaging activities. The special distancing visits with family were really helpful for the interveners and the person we supported. Using themes and sharing stories and successes. Accurate and consistent communication was really important. And then sharing ideas and suggestions. So one of the things we did was we had theme weeks across the organization. So things like Country Music Nashville Week, Harris Week, Jamaica Day. Basically what they did was they took different themes across the world and they basically enjoyed them. So, we have videos of people singing country music. We have people making Jamaica patties and building the Eiffel Tower, out of paper mache, which is amazing. And then we'd share them across the agency so that everybody got to see all the wonderful things that were happening. Patience and sticking with the strategy. Teamwork is key. During this time, we did have some people who were very challenged, and because their routine was not there, it was a difficult time for them, but the team came together and they were able to support and find ways to make this a little more manageable for that person. Talking to the team about your frustrations, your worries, and fear, allowing each other breaks and giving time to care for each other. Having adequate personal protective equipment available in the houses was really important. Utilizing technology to stay connected to the management team, but also with the families and the friends of the people we support, which is very important to the interveners as well. What does the future look like post-COVID? So right now, we're still in the reintegration plan. So reintegration of family visits. June 15th, families received an email to indicate certain requirements are needed to start outdoor visits. including screening for all visitors, proof of a negative COVID-19 test, mandatory masks, hand sanitizing, disinfecting of outdoor areas, and the 6-foot distancing. There was no touching or hugging at this point, which is a challenge for the people we support and their families. The reintegration of the Tremblant Day program. So this just happened this week. So Monday was one of their first days. June 15th, we actually contacted Public Health to discuss the reopening of the Tremblant style program. They did not have a specific plan set out that we could necessarily follow, but they did offer to review one that we created. So we looked at limiting the number of people per location, reducing hours for adequate cleaning procedures, negative COVID tests for all the people returning to the program and the employees, no public transit at this time, driveway drop-offs, only with cleaning procedures, and no respite care at this time. So during COVID, one of the things that we actually celebrated was June was Deafblind Awareness Month. And this is one of the ways that the people we supported actually celebrated. So anybody who was interested got to color a wonderful letter and take a wonderful picture to celebrate Deafblind Awareness Month. Thank you to all the PPE donors who actually gave us PPEs and our money towards personal protective equipment. And thank you. Are there any questions?
Thank you so much, Amanda. You will see that there are questions slowly coming in the chat. I'll let you take a moment to read.
I'm just looking. I might have to stop sharing so I can read. So just give me 1 second.
That's okay.
Yeah.
I'll encourage everybody to get to their keyboards.
There we go. Okay. So those with hearing and vision limited so that they can use technology. It's very true. It was very challenging. For the people that we could support, we did actually have some funding through passport funding to get iPads for many of our people. And so anybody who was able to kind of embrace that, we did. Sometimes the families who, of people who were, had no vision, no hearing, they would drop off things and we would explain, this is from mom, this is from dad, this is what's going on. Some of the people did choose to bring their loved one home, their daughter or their son, so that they cared for them, but it is very daunting for them. So it was very much a challenge. Some of the people we supported actually interacted with each other. So we had a lot of people who are deafblind actually on video chats with each other. We had some sing-offs, we had some good times that way, but we totally understand it was a challenge. With us, we did implement wearing masks, and we do actually have some masks with the window so that they could see our lips, especially if somebody relies on ASL. So we didn't limit our contact with them per se. We just made sure that we were safe, washing our hands after, wearing our masks, and made sure that we were still interacting on that same basis. We didn't want to change our relationship with the person we supported. We just needed to make sure that we put precautions in place to keep them healthy. For the people who took the individuals home, we did not offer intervener supports. That was a difficult time because unfortunately one of the things is we can't control other people or the choices they make or whether they chose to follow the rules that Ontario came out with. We couldn't know if the families were going to visit other people, whether they were going out of the country. So we don't generally tend to offer in-home intervener services. That's not something we generally offer. But we did stay connected with them. We did talk to them. We did help problem solve with them over the phone to kind of support them. Where did we get the window masks? We made them. We have some amazing team members with amazing talent and they figured it out. Things like this are not easy to come like not easy to find. Even the regular masks were not easy to find in the beginning. So luckily we had people who knew how to sew, and that's sort of what we did. What did they use to make the masks? I can ask them. I do not have the skills to be a sewer. So if you want to, maybe I can share my email, and maybe Crystal can share her email, and we can actually get you in touch with the person who sewed the masks to tell you what actual they used for the window for the ASL masks. We were able to continue tactile communication. Again, just a lot of hand washing, making sure we had our masks on when we were in that close proximity to somebody. A lot of our people rely on that touch. And as you can see with our mission and vision, touch is really important to us. And so it was something that we weren't willing to compromise. Any other questions?
For those of you who are interested in the clear face masks, there are actually YouTube videos that can show you how to make them yourself. So if you put in face mask clear window into a YouTube search, you will find a couple of ways of how to make them.
And Jenny actually said that they did find it difficult, even with the windows, for people who have hearing aids because of the muffled speech. We don't support a lot of people with hearing aids. So that's something that we haven't encountered. And to be honest with you, it is the masks, no matter what type of mask they are a challenge. It was definitely a learning experience for each one of the interveners. And it was definitely something that each of the people we supported, we had to adapt to and find ways. Unfortunately, we've had to use a little more tactile sign language with those people, anybody who is struggling with hearing or seeing our faces. So we have had to adapt a little bit more to that type of sign language when there was a little bit of a struggle. Yes, the windows can fog up for sure. We found a few tricks for fogging up, and then, you know, somebody said that you can use certain cleaners on the windows, and that will actually help with the fogging of the mask. With the glasses fogging up, if you have a metal clip that seals, then often the glasses won't fog up as much. They still fog up a little bit. Again, if you clean your glasses, and I can't remember if it's vinegar or what product it was, I'll have to look it up, but if there's certain products that you can clean your glasses or the window with that are less likely to fog. Yeah, the metal clip has been a really good idea, and it's really helped a lot of people with the glasses. You don't want them too tight, because if they're too tight, then they hurt your nose. But it is something that we've sewn into our cloth masks. Hillary actually says if you pull your glasses down on your nose a bit, it'll actually help as well. How much of our training is virtual, and how have you made it interactive? To be honest with you, most of our training over the years has become virtual when it comes to a lot of our training, our health and safety, our fire, even our nonviolent crisis intervention training is partially online. So that stuff, we can just make it accessible to them at home, which is nice. We just haven't done that. We've always had people come in and they do the training at the locations with people and people to support them. So we've always done a lot of virtual training. That's not something that's new. What we've also done is we've implemented Zoom meetings with the supervisor and the person who wants to start. and observations. So one of the challenges we have with bringing anybody new in is that sometimes they think they know what they're applying for and they think they know what the job is until they come in and they physically see it. And so what we've been looking to do is doing observations with the locations with the person virtually. So they would sign a confidentiality agreement and we would do a virtual tour through an iPad, Zoom, BlueJeans, whatever device we have, FaceTime, and we would actually tour them, have them meet the people if they have the ability to do so, and sort of see if it's something that would be a good fit. Is it a temporary measure? Right now, we're thinking long-term, just because we don't know when it's going to be safe enough to bring in just anybody. When we do observations or things like that, they have not become an employee yet. So they usually get their letter of offer after that observation. So we want to make sure that we're not bringing just anybody in without a COVID test. So that may be going on for a fairly long time. Any other questions?
It looks like you have been very clear.
Kim shared, our deaf team has been training on deaf reading and writing, young people using an app on their phones to communicate through text while wearing masks. And there's a video on YouTube. I'll have to check it out, Kim. Thank you.
We still do have a little bit of time if you want to wait for more questions, but until we have more questions, let me thank you. Thank you
very much.
For your presentation, for your time. I am very excited that it has gone as well for you guys as it has. That's wonderful. We've got more questions coming up. I'll give the time right back to you.
How do we manage a transition program for new services? This was difficult. Normally, we have the ability to go and spend time with the person, spend time with their interveners, their family, get to know them, get to know their planning. Unfortunately, it was all done virtually. It was done through video meetings, calls, documentation. So when that person came into service, we had to learn about them straight kind of from the bottom, because although virtual is great and on paper is great, but when you haven't been, kind of shadowing that intervener or that family for a long time, it is basically introducing somebody brand new and you have to figure it out. So it was a very big challenge. We're very blessed with amazing teams at those locations, and luckily they're doing really well. And the constant contact between the family and the previous interveners or the previous services has been invaluable. Are we doing any training virtually on how to become an intervener? We do have what's called a touch program that we actually train all of our interveners on. And so usually after you become employed, then we offer touch training. We are testing our Touch 1 and Touch 2 programs, I think starting next week virtually. So we are going to see how that works. It does include signed exact English, sign language training, does include everything about deafblindness, all that sort of thing. It is our first ever attempt at virtually training, and it is more of a Zoom style training. So we don't have any information on how that's going to go just yet, but that is something that we are implementing this month, which is phenomenal. The in-person training is phenomenal. I did it many years ago, but at the same time, it's still something that stuck with me. We do a lot of simulations, we do a lot of group work, so that may change a bit. So although it's going to be interesting to see, I think eventually we'd like to go back to the in-person, but we'll have to see how everything falls. Was there a significant difference in the deafblind person's ability to settle in? Yeah, a little bit, because I mean, one individual moved from Barrie to Kitchener, and he had a very set routine where he did something Monday, something Tuesday, something Wednesday, and it was very challenging for him because it was all community-based stuff, and he moved literally 10 days before COVID. before we had to basically shut down community programming and planning and basically go into the isolation mode, pandemic plan. And unfortunately, you know, he did have some challenges in the beginning. He based what day it was based on what he was doing in his activity. The team got really creative. So they found ways for him to do those things without actually doing them. So they were really, really creative, and he did struggle a bit. And I think each of them individually had their different struggles, but the team was able to get creative and help them through it. And that's the best part, is they're all doing phenomenal now, which is great, but there is definitely a learning curve, and it definitely was a bit of a challenge.
All right, so I think we're good. Ladies, it was a pleasure.
Thank you so much.
We will let our sign language interpreters take their well-deserved break, and we will see all of you again in 15 minutes at the full hour.
Thank you.
Let's get started with some of our housekeeping notes before we go into our next presentation. For those of you who've just joined us now, we are recording our sessions, and Deafblind International is hoping to have the videos available on their website relatively soon. So in case there's anything you're missing during the presentation, you should be able to go back and have another listen or another look. We've been trying to make the event as accessible as we can. You see that we do have international sign language interpreters that are available for us today, but we did not succeed in bringing you live captioning. We neither had the money nor the volunteers to do so. So we're working on that for the next time. Quick shout out to Layer and Rob, who are signing for us today. It is mostly because of them, but also because of us, that we will keep you to your 45-minute time limit so they can take their deserved breaks when the time comes. For those of you who are new to Zoom, you have an option in the top right corner of your screen for the speaker view, where you can choose a side-by-side view that will allow you to make the window with the image of the interpreter a little bit larger. It'll be easier to see if that is something you want. For the rules of engagement, you will see that we have muted all the attendees, in this case, all 112 of them. And we've also turned off everybody's camera. That is for us to be able to focus on the information that is coming from our presenters, focus on their slide and their information. You will also see that we've asked most presenters to come in pairs of 2. So we have a primary and a secondary presenter, and that is because we encourage everybody to engage with the speakers through your chat feature. So please feel free to write comments and questions in the chat feature anytime, starting now or afterwards, to pose questions. At least one of the 2 presenters always has one eye on those comments and will be able to have a good look to see if they can incorporate answers to your questions. For those of you who use social media, I encourage you to tell Facebook, Twitter, and everybody on the web about us. For Twitter specifically, if you want to, you can use the hashtag DbI webinar or tag us at DbI_connect in order to connect online with Deafblind International. All right, but with no further delay, we're now going to go over to Tracy Luiselli and Susan Bruce, who are going to have control of the screen for the next 45 minutes. Ladies, it's all yours.
Hello, everyone. Good morning. At least it's morning here. First and foremost, we'd like to Thank you for taking time out of your busy days to join us today. It's certainly an honor to connect with you and to give you a synopsis of what we've been thinking about and working on. So our presentation today is Creating Home-Based Routines, a framework for supporting families of children who are deafblind during COVID-19. My name is Tracy Evans-Luiselli, and I'm the director of the New England Consortium on Deafblindness. We're a federal grant with the Office of Special Education Programs, serving the states of Connecticut, Maine, Massachusetts, New Hampshire, and Vermont. And my colleague, Susan Bruce. Susan, would you like to connect and let folks know a little bit about yourself?
Sure. Hi, everybody. I'm Susan Bruce, and I'm a professor at Boston College, and I'm also a department chair. So I watch over a program in severe and multiple disabilities for teachers, and also in deafblindness, and a new program that we started about 1.5 years ago on global perspectives. Great to be able to interact with you. I'll be managing the chat, so I won't be saying a whole lot.
So today's presentation is around describing a framework for working with families and teams during COVID that supports home-based routines and learning for children who are deafblind. So that's the overall arching premise of our presentation today. In thinking about where we've been and where we are today, I think these characteristics are critically important as we think about our engagement with families. And certainly, I'm sure a lot of these characteristics will resonate with all of you, but again, they're more important today than ever. So certainly a whole presence of positivity and being present with families. I think that they're dealing with such difficult, challenging times that it's on us to kind of step up our game and be as positive and engaging as possible. With that, it requires us to really engage in what's often called active listening and responsiveness. So asking questions, but really being engaged via the whole medium of Zoom and technology that we're all using today. So how that happens sometimes is a little different than others, but with my staff and the folks that we work with, we've even talked about notions of really making sure that we're making eye contact, we're using Zoom, and if we have to note something, if we're typing, to let families know that. So really making sure that the listening skills or listening persona that we use in Zoom kind of exudes across the screen. And then next, really thinking about what these families are going through. I think that I've been struck with just how challenging it is. The empathy that we need to have for these families as they go through their day with no childcare, no babysitters, many who need 24-hour nursing care for their child. They're caring for their child and the rest of their family 24/7. So that's really critically important. Next, thinking about the family's culture and language. So it does mean that we have to coordinate more around the use of interpreters, whether it's for Spanish-speaking families or people that speak a whole host of different languages. It does mean that it's a little bit more challenging, but it's certainly on us in terms of our overall responsibility. The next item is the whole notion of being inclusive to other family members. And this part, I will say, in some aspects has been kind of fun as we've started this new journey. It's not unusual for siblings to love kind of jumping into the virtual screen. Sometimes they're leaning over their parent's shoulder. In some cases, I have a little guy who loves to get on top of his mom's head or his dad's shoulders. So certainly siblings are much more active and engaged in the process of our connection with families. And as I mentioned it before, the friendliness aspect. You know, we may be tired, we may be worried ourselves, we may be going through challenging times, but that persona that we present virtually is really, really important as we go through these new times. And then next, the whole notion of sensitivity and privacy. For those of you who have done work in early intervention and early childhood, we've worked in that field to really kind of respect families' privacy more and more. And what is occurring these days is families are showing us their homes, their living rooms, their kitchens, sometimes their bathrooms, their whole living space. So that loss of privacy is very, very significant for many families, and it's important for us to respect that. And if something happens during the Zoom session, I think it's important for us to stop, give parents a break, maybe go offline and then come back. So those are just some of the tricks of the trade that we've been learning as we move forward in this work. I think what's really clear from what parents are telling us right now today is they're exhausted. So when everything hit in our region in March, pretty much everyone jumped on Zoom, and there were so many Zoom sessions that were scheduled with families, the educational teams, all the individual service providers. So what families are telling us now is that it's absolutely exhausting and they're overwhelmed. We also thought that we were going to be able to do some online parent coaching similar to our original approach, but what we're finding is that level of coaching is really too intense for a lot of our families. So it's made us really kind of think about how we should do things differently. So again, parents teaching us, what they've given us are some helpful hints about home routines that can be used across all of the family members, whether it's parents, siblings, grandparents. So for example, thinking about some home routines that happen around self-care, play, and all kinds of different aspects of family life. So the message here is that we've had to really step back and change our focus. We geared our consultation in the past primarily around the classroom and those skills that were indicated in the child's educational plan. So now what we've done is really kind of taken a step back and said, that probably doesn't match with what the family is experiencing today. What they are experiencing are those ongoing regular routines that quite honestly happen regardless of COVID. They have to get their children up in the morning, get dressed, feed them, engage in different activities. So we've moved from that focus on classroom interventions to home-based routines. A positive aspect of this is it's forced us to have an even greater focus on communication opportunities within natural routines. And the three sort of major foundations that we're looking at is the child's level of participation in that routine, their engagement in that routine, and their overall independence. So participation, engagement, independence, those are key areas that we look at as we think about supporting families through this process. So as we've developed a framework for planning and supporting home-based routines, two major aspects are the home routines interview, as well as a creation of various templates related to very simple family routines with simple steps. And hopefully we've been consistent. What we want to do is have that template, if you will, consistent across different types of activities and skills, and then individualizing it to the child on various characteristics. So Susan, why don't you take it away from here?
Sure. And then I'll get back in a minute to the chat as you see some messages coming in. So I am paying attention to that. So I think that all of us, no matter who we work with in terms of children or adults who are deafblind, and no matter where we live, we have a deep appreciation of the tremendous effort individuals who are deafblind put into taking in pieces of information visually, auditorily, textually, and then having to put all of those pieces together into some sort of a meaningful whole, whether it's an idea, whether it's a concept around an object and so forth. So they work very hard at this. And so one of the things we can do is to bring some organization and order to their lives that will help them with putting these pieces together and making meaning. And so bringing organization to the child can be achieved. One way that can be achieved is through providing routines. Routines are repeated. Therefore, it gives, through the repetition, an opportunity for children and adults who are deafblind as well to build concepts that we have embedded and are deliberately addressing within routines. And of course, lessons in a classroom setting can have routines. In the home, getting up in the morning, and all the things we do to get prepared for our before breakfast, for example, those are all routines. Routines also help to create what I call emotional security for an individual who's deafblind. So the predictability, we all want some level of predictability. Even those of us who enjoy a good many surprises in life still need some predictability in order to feel safe in our lives. So this predictability lends itself to emotional safety, helps the child or adult to feel more secure. It also helps in another way. So when you know what's going to happen, it then allows you to predict, and being able to predict then allows you to be able to think of something you might want to communicate. You might want to protest what's coming up next. You may want to celebrate or comment on what is coming up next. Tracy, can you move to the next slide? So we think about routines in a variety of ways, but one simple way to think about it is routines that occur within an activity, which would include lessons in a school setting, but is a much broader concept than that. And then on the next slide, I'll talk about between activity routines. So we talk in the field of deafblindness across cultures about the importance of having a clear beginning, middle, and end of the activity. This isn't because we want to be overly predictable and boring, but we want to set some structure so that the person who's deafblind understands what to expect and can feel comfortable and anticipate, and because it will elicit communication, as I said a moment ago. So through the use of making sure there's a good orientation in the physical space, cues the child receives by just how they're positioned and what adaptive equipment and assistive technology is present, and orientation to materials are all ways we help children and adults who are deafblind to understand what's going to happen within an activity, which then facilitates them to be as actively engaged and as independent as possible. We use touch cues as well to help them understand what's going to happen next within an activity. We can also support them by giving names to our activities and repeating those names each time the activity occurs. So being consistent in our naming is helpful. We can embed key vocabulary, and we all do this. And I gave you examples that are more around time and process or procedure, but there are other key vocabulary that are specific to an individual routine that you might want to embed. But key vocabulary that could occur across activities could be first, next, now, later, one more, two more, all done or finished. So again, the repetition of these messages then gives more opportunities to practice, more opportunities to hear the language or see the language or feel the language if it's tactile sign language. We also make use of finished and all done bins at the end of an activity, which helps children to understand what happens, and then we transition them through their daily schedule to the next activity. So we can start with simple routines, and we can embed a limited amount of vocabulary that we really focus on as key vocabulary, and then we can increase the complexity or move to more advanced routines later. We can expand a routine. And then between these different activity routines, we really need to help the child or adult who's deafblind to feel secure between transitions, particularly individuals who are prelingual. So we need to have clear procedures between transitions from one activity to the next. And again, key vocabulary plays a role here. We can represent these activities, of course, in our daily schedules. Some people prefer to call that an anticipation shelf, and still others call it a calendar system. And we have expertise in that all around the world, of course. What I like to teach my students is to please think of the daily schedule as what I call one of our classic literacy lessons. So a daily schedule isn't just a tool for transition. And unfortunately, when people think of it that way, they rush. They have the child touch something without really thinking about left to right procedures and what's been already accomplished and what's yet to come. And they're not really thinking about parts to whole learning when the child touches the representation, such as an object representation. So I really emphasize the daily schedule as a literacy lesson every time you go with the child or adult to the schedule. And that then helps people to have like more respect for it, I think, and to understand this is where conversation occurs, and that many of the elements of the daily schedule build us toward literacy skills.
So thank you, Susan. So thinking about function routines in the natural environment, that ultimately is what we're talking about when we're talking about home-based routines. So a routine-based model generally focuses on those functional skills within the family routine. So it's important to step back and consider what really is going to make a difference for this family. What's going to make this situation and their engagement with their child easier? What are those priority skills that really sometimes can be troubling, that we may be able to help to redefine, reorganize, and infuse strategies that may help the students' engagement, participation, and independence? So again, we're thinking about those daily routines, examples of morning time, playtime, and evening, and the possibilities are really endless, and so much depend on the family's culture quite often, whether there's a single or two parents or additional adults in the home to help support and provide, different caretaking types of activities. So the variability is really quite significant. So within this approach that we're looking at, the first order of business is to identify the priority routines with the family. And what we're working on is a whole routines-based interview with the parent. And again, I will say this work is certainly ongoing. It's a work in progress. But what we've learned with COVID, it's much more effective to ask a family what they would like to work on today over a short period of time. So many of us are used to focusing on annual goals, but asking a simple question of, what's the one thing that you would like to work on during the summer, or something that you'd like to see change or grow between now and the end of summer? We're finding that those shorter periods of time are really important. And then the next aspect related to the interview is looking at our intensity of supports. Some families really cannot engage right now. They are really dealing with such significant issues on top of health issues. And then other families want perhaps just a tidbit of information on a particular topic. It could be dressing, it could be feeding, it could be some suggestions around use of an AAC device or play or leisure types of suggestions. And then we have some families that absolutely want very intensive engagement, want to work on very targeted routines and activities and skills for their child, and really want to use this time now that they're home. Many of them are not working. They feel that it's definitely a better time for them in terms of their sort of different family life outside the home. So using a routine-based interview, I just want to underscore this work really came out of the whole field of early intervention and early childhood, which is really kind of I've had to step back thinking and reflecting about how we work with families in early intervention and early childhood versus school age. So with the younger approach, folks really are trained to focus primarily on what are those routines within the family that you want to target in terms of intervention and support. And what's come out of that research is that outcomes tend to be much more functional. Families are more satisfied because they're working on things that they have to do for their child or are necessary to do for their child every day, regardless. So what we're finding is that, again, those experiences are more meaningful, and progress certainly can be much more significant and pronounced. So within the interview, we talk with the family about their schedule, conduct the interview process, again, looking at the child's level of participation, independence, and engagement. And then we look at what are those activities or routines. There are the routines, but what are those then routines or activities that occur throughout the day most frequently? So for example, if a child has a particular routine that only occurs once a week, it's going to be challenging to work on that particular aspect versus an activity that occurs daily. So it's just something to consider as you plan and engage with families. So you should have an example of the routines-based interview, and this is just a quick synopsis. I'll give you a quick overview. The actual routines indicated in this form can change. They could, again, the possibilities are endless. But in this example, it shows a morning routine, online school routine, which is sort of becoming the norm right now, play leisure, evening routine. So you go through these particular routines and you ask the family, how are these routines going for you? What's going well? What isn't going well? And then if you had to rate this routine for you, your child, and your family, 5 being good and 1 being not so good, where do you think things are? It's not unusual for families to say, well, this particular part of the day, routine of the day, is an absolute disaster. So I feel frustrated. I don't know what to do to help support him. He doesn't feel supported and engaged, and we end up having behavior problems. That's an area I might need help. So obviously that's our red flag in the discussion, that may be an area that we want to address. But we start out by talking about what are those key things, those rituals that happen every day in your world that we can begin to look at in terms of some strategies and supports that might be helpful. Once we identify the routine, we look at the actual activity. So for example, there are various ways of looking at this. Some people look at just the activity and the skill. This approach really talks about, and I'm going to use a little analogy here. So this large blue cup would be seen as the actual family routine. So maybe that's the morning routine. Within that morning routine, there's an activity that happens every day, and that's toothbrushing. It happens in the morning. Within that activity of toothbrushing, there's a focus on the actual skill. So you can see they're all embedded and nest within one another. So this is an example of a beginning skill. The adult guides the child to the bathroom, signs and says, brush your teeth. The child looks at the adult and regards and signs and interprets the verbal and visual cues. Then the child locates the toothbrush and grasps the handle. Adult provides the hand under hand guidance to brush and signs and verbal direction to spit and rinse, and then directs the child to guide the toothbrush to the edge of the sink. The primary target in this particular activity is the child gaining joint attention or engaging with the adult, and then looking and grasping the toothbrush. That's the key focus of that particular aspect. And again, this is just an example of what you might work on. A more advanced skill, this is an example of a student for this particular case where the student can do all of the steps or the aspects of toothbrushing, but in terms of initiating it on their own and kind of getting going, they still need a cue. Not always the best way to do this, but again, just showing you an example where the adult guides the child to the bathroom and then signs and directs the child to brush their teeth. I will say I've been surprised at the number of families that we're seeing where actual routes to different places in the home sometimes can be chaotic. So sometimes a family may use different routes to go to different locations. And the only aspect of that may be of issue is going to take the child longer to be more independent, because they're always going to need that adult to go from point A to point B, because it's not in a consistent pattern. So again, just another consideration. And step 3, this is where you get into the real detail of the routine and the activity and the targeted skill. So we really want to consider the steps in the activity, and then what kinds of communication, sensory, and physical supports are needed to promote that participation and independence. So under sensory, obviously it would be vision, hearing, and tactile, communication, receptive, expressive, and then thinking about the levels of physical support. So we often hear from various folks that it's easier to do for, not with, especially if you're a busy parent, you're trying to get out the door. So really talking about those aspects of partial assist, and where you can coach parents to perhaps back off on a little bit of that physical guidance if it's appropriate. So there's also a planning form available for you folks. And it looks at the notion of sensory communication and tactile and physical supports. And these are all the different areas that you would have a conversation with, or at least consider with your families and with your teams around what's the best approach to outline those particular steps within the activity. And then finally, looking at monitoring progress, I think that we try and be as empirical and as organized as possible, but given our current situation, I think we really have to adapt to where parents are. However, parents give us rich information just by simple interview. And I think that there's opportunities today to be very concise, but also direct and say, you know, I gave you these suggestions and obviously you've been great about implementing, but let's step back and think about what's working, what might be working. Is there another way that we can simplify for you? So really thinking about that whole discussion and back and forth. Having said that, we do have families right now that are very engaged with sending us video clips and wanting information. Hey, I did this particular strategy at mealtime. What do you think? Do you have any particular suggestions? So again, we have to meet parents where they are, and also sometimes with additional support from the educational team as well. And then finally, one of the things that we want to focus on more in the fall, and I'd like to give a shout out to Dr. Jennifer Grisham-Brown at the University of Kentucky with the Kentucky Deafblind Project, because we started kind of going in this direction or thinking about this whole notion of goal attainment scaling. We may be able to do that as an assessment measure with sort of more intensive organization that we have right now, but we really want to think about the materials, people, and settings where these particular skills occur. So for example, it's not unusual for families, a dad to say, well, he'll do it for his mom, but he won't do it for me. So if the family really wants to work on that, what we're going to address is really helping support that particular skill and the family's working on it and having it generalized across other family members. So again, just another example of the different aspects of monitoring progress that can be considered with this particular routines-based approach. Next, what we've been looking at is once all of this has been pulled together, we create a template which has some key consistent components. And the first portion of that is initial consideration. So what we want to do is really think about the learning history and then those supports that I've already indicated. Learning history, I think, is really important, especially when you look at skills related to toileting. So it's not unusual for many of our students, for a variety of reasons, have had various toileting programs or approaches used over the years that haven't been successful. We are definitely hearing from families that they're more willing to engage in more intensive toileting approaches right now. However, if a student has had a negative experience and has spent a lot of time in the bathroom and it hasn't been pleasant, or they've been kind of confused about the whole process, we have to really think about other things that we can put into place that might change that aspect of the whole toileting approach for that student. So learning history is really, really important. Next, the whole notion of materials. And this is not an easy concept because, again, families' lives are so busy, but giving suggestions such as maybe there's a small bin or a box that you can put the materials in. So each time the routine, that activity within the daily routine occurs, all of your items are ready to go. That's just one particular aspect, but really having the materials organized and ready to go is an important aspect. And next, outlining those steps. So one of the pieces that we've also really been focused on a lot is coaching teams and families around the importance of gaining joint attention, whether it's eye-to-eye contact, whether it's touch-to-touch, hand-to-hand, physical contact. But it's so critically important to get joint attention before you all of a sudden try and jump in to this particular activity. And then thinking about all of the steps as it relates to communication and sensory aspects, the appropriate response time. We know that many of our students need additional time, and having that dialogue with the family, that's not always possible. So how can you pick potentially that one thing during the day where you are going to really step back, focus, perhaps count to 5, and then engage the child again? So response time is really, really often very challenging for busy families, certainly with additional children. Thinking about things around reinforcement, ideas that can be easily used, and then thinking about what do you do if you've tried everything and the child doesn't respond? The typical normal human response is we repeat the prompt over and over and over again. Sometimes it's easy for our volume to go up or our intonation to go up, which sometimes can help kind of unbeknowingly help trigger certain behavioral or negative responses. So again, another point of discussion with families as we go through this process. And finally, related to the template is the monitoring process that we'll be including in that as we move through. So this gives you just a very simple look at the template that we've been working on. So we have the considerations, the materials are outlined, the steps are outlined, and then evidence. We've added evidence because as a federal grant, it's really important to have our evidence base there and make sure that the team has access to it. So we'll be including some articles and tools, and for some of our families, certainly some easy access to blogs and parent perspectives in terms of these different approaches. So this is just an example of the actual template itself. So here's the template used around a particular routine. The routine is bedtime, and then the activity within that home routine is getting into pajamas. So again, the considerations have all been addressed. The materials are the pajamas and the clothes hamper. And in the steps indicated here, the adult does everything in the sequence, except at the end, the child is going to take the dirty clothes, pick them up, walk with the adult to the hamper and place the clothes in the hamper. So that's just the very simple little level of engagement that's being used in this particular routine. At the end of the routine, the parent then presents the AAC device, points to the picture of the pajamas, and provides praise with the thumbs up. So you can see it's a very, very sort of beginning skill level aspect here, but we're also infusing the communication piece with the use of the AAC device. Once again, the possibilities are endless. I just want to give you an example or a sample of some of the approaches that we've been using. The next example of the template, this again is just an example, but we're using the structure of this template, is if you look at the materials, this is a child with cortical visual impairment, and there's a specific tray. There's a yellow plastic bowl that's used every morning for breakfast, and the Cheerios and milk are arranged. And then there's a blue spoon with Mylar, which is shiny tape on the grip of the spoon handle. So in this particular activity, the adult again is preparing everything, setting things up, waits for the child to look, gain a joint attention, and now the adult is providing guidance to the child with the notion that the child's hand is on top of mom's hand, and the child is holding the spoon. The adult is holding the spoon as the child brings the spoon to the mouth. So the adult holds the spoon in front of the mouth, and they coactively, simultaneously bring the spoon into the child's mouth. The skill here is the child is going to chew and swallow, and the adult provides praise and then a touch cue to the throat. So again, the possibilities are endless, but the actual activity and the steps within the activity are all noted here. And then we would include articles related to eating and self-feeding, and perhaps some blog information for families who have gone through similar experiences, use similar techniques, and might also have some suggestions. So again, another example. So final thoughts around this whole process. I think once again, we really had to step back and think about how we can use a consistent approach. Home-based routines, it's not new. Again, it's very embedded into the work of early childhood approaches, early intervention. What we're looking to do is use templates that can be used across a variety of children, a variety of situations, families, and cultures. So the key aspects that would change are perhaps the materials and the steps that would be used in the templates that I just showed you. I think the exciting aspect of all of this as well is that we hope that these routine templates will be used back in the classroom and continued at home, but perhaps we're also helping to put parents in the driver's seat because they can go back and educate the team around the different routines and activities that they've been able to develop and use consistently with their child at home, and they've been able to see the progress and the positive impact. Another really critical piece that we wanted to underscore is this whole notion of collaboration. I know many of you know this, perhaps I'm preaching to the choir, but your team, your teacher, the visually impaired, teacher of the deaf, speech language folks, educators, PTs, OTs are invaluable when it comes to completing that planning form and addressing those steps and embedding all of those different skills and strategies within the actual activity. And I think it's also more so than ever important that we're collaborating so we're using the same language and parents are getting a consistent message. And then finally, every time you think that you've got a template and it's concise and simple, what I've learned is I look back on it and I think, okay, I've got 6 steps here. How can I get it down to 4 or 5? So again, thinking simple across the way as we support families. And I just wanted to thank the families that have taught us along the way. We're still learning. Again, this is an approach in progress. And I'd like to give a shout out to Talia Mango, our educational consultant, who's been helping us with the templates. And so with that, I'd like to turn it over to you, Susan. Do you have any additional comments or thoughts from the gallery?
Oh, the chat room has actually been quite busy, so I've been responding to various people. I really admire the work, Tracy, that you and your team are doing with the routines, and I think it's important to say that each of these interactions with the families has been tailored to meet each family's needs and respectful of things like some families might be interested in highly responsive to routines that have many steps like we use in classrooms, and others really would feel like that's just too much during such a difficult time. So I think you've been really respectful to individualize this to the family's needs.
So ladies, congratulations on having reinvented how to handle the chat. That is exquisite. I have, of course, a self-driven question. As a researcher, I look at this and I see so much potential as a research tool. Have you already used this in a research context?
We haven't, but definitely we're constantly thinking of different ways to do that. So I'm welcome. I welcome any discussion on this. I think that, you know, certainly it applies to COVID. You know, it's really pushed us in that direction, but it's really made me think about our work. And I've thought for so many years that we engaged parents and we included them within the team process. And as I look at this piece, we haven't spent enough time looking at what does that picture look like for the family and how can we address learning in a more meaningful way. We have to also look at, you know, fidelity of implementation as it relates to parents and their ability to take this information and implement it, and really perhaps categorize the levels of implementation. So I'm certainly open to discussion on that. Anything else? Any other particular themes or questions, Susan, you'd like to highlight?
I don't think so. I'm just trying to finish up responding to some of the chat. But it was great to have a chance to participate.
And, you know, as I mentioned, this is a work in progress. I hope certainly over the next few weeks, we're going to be looking at various templates. A lot of this is just simple task analysis that's been done by a number of people in the field over the years. I found it quite interesting when I looked at strategies for around toileting for a child who's deafblind. I didn't find a lot of current information, and I thought that was really interesting. So looking at updating some of that information and collecting it and putting it together for families that's easy to digest is certainly an approach that we want to look at. Okay.
Excellent.
Anything else?
Ladies, let me take this moment to thank you for all your work, for your time, for joining us today, for your presentation. Great pleasure. Great way to end our sessions today. I thank you, and I will send you into the rest of your day. I will thank also again our sign language interpreters for all their work today. And join us for day 4, starting tomorrow, 6 o'clock my time. I'll see you.
Bright and early. Thank you.
Thank you.
Bye-bye.
Good to see you.